Aloha all. We are reconvening the House Committee on Finance for the purpose of a budget briefing from the Hawaii Health Systems Corporation. Thank you very much for joining us. Today it's roughly 9 a.m. on January 15th. We're in room 308. After HHSC, we'll be joined by the Department of Human Services. So whenever you'd like to proceed, go on ahead.
Good morning, everyone. Good morning, Chair Todd. Good morning, Vice Chair Takenouchi and members of the committee. My name is Edward Chu. I'm the President and CEO of HHSC. I appreciate the new setup here. I don't see any like the big mics that we used to have before, so this is great. With me, I have representatives from all of our regions. Noticeably, you'll notice none of them like me because they left me sitting here by myself in the front row. They're all behind me, so I lost all my offensive linemen pretty much. But I'll introduce some of the key members from our regions. We have Dan Brinkman, who is our CEO of our East Hawaii region. We have Kurt Akamine and Christina Sato from our Kauai region. That's Sigawa Sensitive Regress, but he couldn't make it to this briefing. We have Stephen Nawahine from Kahuku Medical Center. He's the CEO of that facility. Sean Sanada, he is our newly appointed Oahu region CEO effective January 1st of this year. So he's here with us. Clayton McGann should be joining us shortly. He's our West Hawaii region CEO. He's probably stuck in traffic because his plane got delayed. So anyway, just thank you for the time to provide a budget briefing on HHSC. You have in front of you our briefing packet. I won't go over everything because it is quite voluminous. So I will just kind of focus on a few key points. As you know, healthcare is going through quite a turbulent time. We have pressures from the federal level. Here in the state, we also have pressures in terms of finding personnel for our facilities. Cost of living and everything does factor into the affordability for personnel that we need to staff our hospitals and our clinics and our other operations. Attracting doctors as well is a big component. So, we've done our best to try to be a good steward of state resources, knowing all those things, and also try to provide the care that our rural communities really need. So, as you can see in our mission is to provide accessible, high quality, cost effective services which address the healthcare needs of Hawaii's unique island communities. And as you folks know, we pretty much are the rural safety net for the state of Hawaii. We have significant historical challenges that you folks have heard before if you've listened to our budget briefings. One of the major ones of which we are heavily reliant on government type payers based on our payer mix, where about 74% of our patients are either Medicare or Medicaid. So those are the worst payers, and because of that, that's why a lot of the reason why we need subsidy every year is because our costs are higher than what those reimbursements are able to cover. Also, because of our status as a state agency, we are bound by state collective bargaining agreements, and part of the difficulty of being part of the state is the fringe benefit rate is very high compared to other private hospitals. Other private hospitals' fringe rates are around 30%, give or take a few percentage points. HHSC's fringe benefit rate is the same as other departments in the state, about 64%. So if you take the delta between the 64% and the 30%, that's about $90 million of our need for general funds. So it's a huge chunk of that. And again, we are subject to we are one of the more heavily regulated industries in the country, and we are very much impacted by changes in federal policy, federal actions. As you probably know from the OBBBA or HI1, whatever you want to call that bill, we are heavily impacted by that. Although a lot of the impacts for HHSC probably will come in future years. But we try to do our best to provide the best services we can, quality care to our communities. We also do our best to try to grow revenues where we can. So our operating revenues for fiscal year 2025 actually represent a 10% increase over the prior fiscal year. And from fiscal year 2023, it's a 22.5% increase. So we've done our best to try to negotiate payer contracts to be at least on par with private hospitals, if not better. And we also try to maximize the federal funding opportunities. So that's a lot of reason for our operating revenue growth. The other thing we've been doing is seeking philanthropy. You folks have heard in the past about the East Hawaii region and their generous gift from the Benioffs of $50 million to help fund the ICU and other projects. Last session, you folks helped put up funds for the KL Outpatient Center, about $25 million in state money, but that's being matched by $25 million in Benioff donations. So it's going to be a huge benefit to the residents of that district in the Puna area. And Kauai region just recently received $11 million from the Helmsley Charitable Trust to build out an MRI imaging suite and also to expand the learning lab at the KVMH facility. And Representative Morikawa was there with us, and it was a great day for the Kauai region. So in terms of budget requests, just wanted to let you know the emergency appropriations, we are not asking for an emergency appropriation this year, assuming we can get our restrictions released that the governor has imposed. It's a 10% restriction he's imposed across all agencies. We are in the process of putting in a request to get those restrictions released. That hasn't been a problem in the past, and I don't anticipate it being a problem this year, but if that doesn't come through, we may have to come back to during the session and ask for funds to replace those funds. In terms of our supplemental budget request, we did get funds in last session for the biennium budget. We are not, at this point, not asking for anything more than what was in the biennium budget, and the governor has agreed with that. We know that there is uncertainty regarding the federal actions, but we feel it's more responsible for us to maybe wait to define what those actions are, see what the impact is to HHSC, and maybe come back down in this session, but the next session to see if there's any need for additional funding at that point in time. So at this point, we're not asking for anything more in operating funds for the regions and for corporate, which are HH 210 and HH 212. But you will see a significant CIP request, which we have detailed in our tables, so you can see that. The biggest one, obviously, which you've all been probably heard about, is the West Hawaii region, on the new Cornell Hospital campus that Queens is proposing to build. We are looking to build a medical office building or outpatient service center on that property. The governor is supportive of this project, and the request is for $50 million for planning, design, and construction on that facility. East Hawaii region also has some infrastructure requests that are detailed in our packet. And I think in your tables, we also show the two large requests for Kauai region. One $3 million for front lobby renovation for KVMH, and $3 million for Stanley Makalona Memorial Hospital for their affordable housing to start up that project as part of their master plan. And the Oahu region is not asking for additional CIP projects, but as working with the Budget and Finance and the Governor's Office, we know the state was looking to try to take back some of the general funded CIP appropriations that were given in 2022 and 2023. So we were able to work with them to identify some projects that were not able to be, that we hadn't fully started yet, and we were able to defer. So we are letting those, working with BNF, we're following their guidance to let those projects lapse, those appropriations lapse, and then ask for those funds in CIP funds or C funds in the 27 supplemental budget. So that's the Oahu region request. Oahu region HH 215, you'll see in the charts in our testimony, no additional general fund request, but the increase in the CIP appropriations is those lapsed funds in A funds that the governor is asking us to resubmit as C funds. And later on, we'll have Kahuku Medical Center give their request, but they've been getting about a little over $2 million a year in general fund appropriations. And that's been pretty constant over several years. Their costs have risen quite a bit during that time. So they had requested about $5.2 million in general funds. The governor's recommending a little under 3.5 million in general funds, but it's much needed by that community to help pay for things like the emergency physician costs, lab services, contracted costs, wage increases for the employees that are being negotiated. So that's what those funds are for. They also have some CIP requests as well. Maui Health System. See them here, but I'm sure they'll be briefing you folks on their requests at some point in time. Because of the agreement that we have with Maui Health Systems and Kaiser, HHSC doesn't necessarily get involved with their operation because the change of ownership. We need to be pretty separate in terms of how we don't get involved in their operation and we don't get involved in their finances. So they'll have to present on their budget separately. You folks may know that with that HR1 impact, there are several things that are coming up for the state. Medicaid eligibility is a big one. For depending on which area of Medicaid eligibility is impacted, there are significant impacts to HHSC as well because again, a large part of our payer mix is Medicaid. But one of the ones that are directly staring us in the face is a cap on our uncompensated care payments. So this program has been in effect for for over 10 years, and it's a program where we get additional federal funds for our losses that we absorb from performing services for Medicaid requested uninsured patients. So this amount of funds that you can imagine goes up every year as our losses to serve those patients increase. It went up a lot during the pandemic because there was an increase in the federal matching percentage, and it's kind of come down slowly since then, but that's been critical for us to help reduce our reliance on state general funds. So in the HR1, the method that's being used to give us those funds that we worked with MedQuest to develop is being capped right now. So in the fiscal year 2025, we're getting 2026 I should say, we're getting $70 million from those funds. It's going to be capped at that level going forward, and starting January 1st, 2028 is if the HR1 isn't amended, that amount will go down 10% per year until that bucket goes down to defined as the Medicare rate for HHSC. So we're working with MedQuest to try to determine what that amount is at this time. I'm sure at this point they're more focused on the Medicaid eligibility issues because those come up sooner. But the impact could be quite large to HHSC. We have projected in 2027 that uncompensated care money will go up to $83 million, but that's not gonna happen at this point, so that's a difference of $13 million from what we're getting now. So there's various other impacts on HHSC from the HR1, which is delineated in our testimony. In terms of some of the impacts, it's really disproportionate in terms of how it's spread across the islands in the state. So if you look at Hawaii, even though it's the largest number in terms of gross number because we have the largest population, when you look at the neighbor islands, the share of people on Medicaid and in the exchange, healthcare exchange are much higher. So it's a higher impact on neighbor islands than it is on Oahu. So we're looking at, from some reports we got from MedQuest and the Healthcare Association, it's about 47,748 Medicaid beneficiaries and members of the health insurance exchange will be impacted by loss of coverage by the HR1. So Oahu's level of about 2.8% of all the population will be impacted by this, but if you look at the neighbor islands, it ranges between 3.8 to 4.7%. So neighbor islands have a much bigger brunt of that impact. And one of the things that has impacted by the federal shutdown, that federal government is going to be in operation until January 30th. There's another federal shutdown. There are impacts to HHSC. The Medicare telehealth waivers may be impacted again, and the Medicare low volume adjustment, which is about $1 million worth, probably around $1 million to Corner Community Hospital. That program is funded through January 30th, and it needs to be extended further. So they only receive a portion of that money up until January 30th. So that it does have some impact to HHSC. For Oahu region, Sean Sanada is here, and he can answer any question you may have about Oahu region. But I think the main thing to point out for Oahu region is that they're doing a lot of things to help other state agencies and help the healthcare infrastructure using the parcels of property that they have at Leahi and Malahia. You know that last year they opened the Daniel Keataka State Veterans Home, about 120 beds there. It's going to be a great benefit to the veterans in the community and their Gold Star families and their spouses. So that's a brand new facility. They also are continuing to work with the Department of Health to fund some of their programs for substance abuse patients, and they also have a program with the City and County Court program at Leahi, in partnership with Queens to do some type of medical respite facility there. And Malahia, they also continue to work with Queens to help take waitlist patients from them where they can. So, and they're also currently working on a project with the Children's Justice Center to use some of the space at Leahi to house some of their operations. So they'll be moving from where they're currently at to the Leahi campus. So they're working with partnership and community to try to help benefit the overall state of Hawaii. So with that, that's all I had to present. If we have to answer any questions any of the members have.
Great, thank you. Members, do we have questions? Actually, I start with Chair.
Oh,
Martin.
no, I'm happy to do that.
Oh, okay, go ahead. Get us started, go ahead.
I didn't have a question.
Oh, you were just trying
I was just breathing because that was a lot of
Oh.
information. Anything.
Okay.
Just trying to read through the paragraphs.
Okay, who's gonna break the ice? Marco, go ahead.
Thank you for Kauai. I think KBMH is a facility that we're all very proud of, and I'm just glad that you guys have your antennas out to get these donations coming to our hospitals. Thank you very much. My question is about that proposed HMSA HPH affiliation. How would that affect you guys?
It's picture's a little cloudy on that because we don't have a lot of details on what that proposed affiliation or merger, whatever you wanna call it is. There's been a lot of promises made by HMSA and HPH regarding that affiliation, the benefits of it. I know there's been, the Senate Consumer Protection Committee had a hearing on it, I think it was Wednesday or Tuesday, maybe, not Tuesday. Regarding that affiliation, you heard from a lot of the healthcare providers that there's concerns regarding that affiliation. I think for HHSC, the major concern is that, access to rural healthcare is maintained. Whether that be, and then for us, that probably be keeping care local to the extent possible. There is some concern that from an overall statewide perspective, if you have a system in place where patients that are able to access HPH facilities get a better deal than, let's say, those that are not that don't have HPH provider in their community, is that fair across the statewide equitably, right? Like if you look at Hawaii, County of Hawaii, County of Maui, they don't have any HPH providers in their community, so yes, they will have choice, they may be able to have choice, but at what cost? Is there gonna be a higher price they have to pay for that ability to choose on their island? So is that fair across the state? And also, when you look at how the relationship is, you tend to, if you look at an individual, you tend to treat your family members a lot better than you treat your acquaintances, right? Or at least I would hope so. But so in that sense, if you look at HPH and HMSA as, probably like a family, right? They're kind of joining together. And you look at the rest of the healthcare community as maybe the acquaintances, is it gonna make it harder for us to negotiate fair rates? Is it gonna make it harder for us to maintain the services that we have across the system? I think those are the concerns we have about that, in general. I think, as more details come out, we'll have a better picture of what that looks like, but I think right now the picture still looks pretty murky. And as we get more details, HMSA has talked to us and said they were willing to continue discussions with us going forward as more details are available. So we'll learn more later, but I think at this point it's really hard to say. There are concerns about market shifts in terms of, where the patients go. HHSC, HMSA reimbursement is about $90 million of our revenue, so it's quite a big chunk.
Thank you.
Pruso?
Thank you. It seems that we have patients stuck in acute beds, and the cost for that kind of treatment, even if they should be actually stepping down and transferring out, because we don't have any facilities to transfer them into, it's costing us an additional $2,000 to $3,000 per day per patient. And I'm wondering, number one, how many beds statewide are actually occupied in that way by patients who would be better served in another kind of setting? What's the annualized cost for that? And how does that cost compare to the cost per patient per day in a step-down facility or a long-term treatment facility, if you know?
There hasn't been a lot of data on what the overall way this picture is. I know the Healthcare Association is trying to get a lot of that data put into what they call the healthcare capacity system, which if you guys folks don't know what that is, it's a website where the hospitals feed data daily. Actually, every 5 minutes they draw data from the hospital, so you know exactly what the emergency room occupancy is. You know exactly what the inpatient is. Even down, you can drill down by unit. But the waitlist information is harder data to pull up for that resource. So I haven't seen a study yet in terms of the overall number across the hospitals across the state. Last studies I've seen were way back in the early 2000s. That they've done a statewide study on the waitlist issue, so it's been a while. But again, we're trying to get that data for that. I think we have Dan and no Clayton made it here yet. Oh, there he is. Okay, they can speak to their individual hospital in terms of what the waitlist numbers are for them. But it is a big problem. Queens has a huge one. Maui Memorial also has had a pretty huge wait list issue, but if you wanna hear from them, they can give you the numbers for their particular facilities.
I guess my question, I'm more interested in a system level kind of analysis, so I'm just curious, I mean, I guess I am curious about how do we then plan for and advocate for the development of more of these long-term care beds and step down facilities if we don't know how, like, we don't have any data to support that advocacy.
That's exactly why we're trying to get the healthcare associate trying to get that data. But then it's not as simple as like the emergency room admission to try to pull that from the electronic health record, so it's a little more complicated process. So that's why the data hasn't been pulled together for quite a while. But it is something that's on top of mind for a lot of especially our hospital members and the healthcare association, because it does eat up a lot of resources. And
Do
we
you
don't get
need-
reimbursed for that.
Like, do you need the legislature to request a study or something? Like, would that be helpful?
No, I don't think that's really necessary at this
Okay.
point in time. Like I said, we're
Yeah.
working on it as a healthcare system, so.
But your data won't necessarily include like the whole universe, right?
We're working on it as a healthcare system, so.
Right, just for the system, but I'm saying like it won't include, this is a statewide problem.
Yeah, when I say the system, I'm
Right.
talking about all the hospitals in the state.
Oh, okay,
Yeah,
okay,
not just
okay,
HHS.
okay, great, thank you, Chair.
No problem. Members, additional questions? Okay, go for it.
Hi, thanks for being here, everybody. Good to see you. Actually, some quick questions for Oahu region. Sean? Congratulations on the new role.
Morning,
Just-
Chair, Vice Chair. Okay, go ahead.
I just want to check in on some of the things that I usually do. Is there an updated timeline for the publishing of the strategic plan for Oahu region?
So we're currently in the process of revamping it. So during the transition, we've analyzed the things that we have accomplished. Our original plan, dated back to pre-2019. But because of the transition, from Derek to myself, we're gonna develop a new plan starting next month's board meeting. So I mean, we're in the process of keeping some things, but adding new strategies. The reason for that is we recently received the executive summary from our project with the University of Hawaii School of Architecture, the Community Design Center. They did a full analysis of the Leahi campus, all of the spaces that we had remaining, and they proposed a couple good ideas that we probably will incorporate into our strategic plan. But we just received the executive summary this week, so upon review of that, our plan is to develop and propose for review with our board a new plan. It'll be strategic plan Oahu Region 2026, and that will project over the next 3 to 5 years with most likely a 1-year working plan to be incorporated into the 3 to 5 year strategic plan.
So stuff available for us when to look at, I guess, in your timeline right now,
I think we would have a pretty solid draft and direction later on this year.
end of 26.
Definitely by the end of this year.
Okay, and so the UH work is gonna be incorporated into the strategic plan at this point, when you get the full
So
data
the
from them.
UH work has been completed, it's just that we need to now review everything and assess what's actually realistic and what might be a little idealistic. And then once we sift between the two, then our plan would materialize a little bit more clearly.
Okay, great, looking forward to it. I know there's been a lot of starts and stops on that one, so yeah, looking forward to that. And then I know you mentioned again, the space that we're renting out to some of the other facilities, so just a couple quick updates on that. So the core section, the beds that core is using for their program, is that the city's core program or is that a Kauhale project?
It's part of the city's core program.
Okay, cause I've seen it in some of the Kauhale documents, I wanna say, so I just wasn't sure about where so all the work you're doing is directly with the city and that's it, okay.
So unless there was some changes that were made on the city side, because we don't get directly involved in their operations and their framework.
Yeah.
We more provide ancillary services for them and provide the space. But originally it started off as a move. They were situated in the Iwale facility and then a DOH needed it, so then they moved into our facility.
Yeah.
But then they changed the I guess the dynamics of the program by bringing in North Shore Mental Health to make it a medical respite. So that's how it started, and that's how it's been maintained to my knowledge. But if it's changed since then, I'm unaware.
Okay. And then, okay, since it's the city's program, I know last year I brought this up, are we charging them rent for the space?
We are not. We charge them CAM, so for whatever utilities and whatnot that they utilize, plus any maintenance services that or other ancillary services we provide, we charge them for that. But we're not trying to make money off of the use of the space just because it's a public important public benefit that's being provided. If it was something revenue generating or whatnot, then definitely we would be charging them market rent.
Okay, I still think, again, could, even in Wallachia for Queens, I think we could be charging them a little bit more just for the benefit of the health system. Sorry, a couple more quick ones, Chair. And then, sorry, speaking of Wallachia, I drove by the other day. Any update on the parking lot? That's been kind of in flux for what, like 8-9 years now?
My understanding is that it's highly likely that the project will commence soon. I mean, there were no direct dates that were given, but the contractor is ready to go. I think all the permitting and everything is completed or close to completed, and so we're hopeful that they'll actually break ground very soon. But I don't have any dates right now. I understand it has been a project in limbo for a long time, but a lot of that was related to neighborhood concerns, about the construction in the first place, and particular individuals who initially opposed and then decided to I wouldn't say support, but be neutral about it.
And then, since it's been so long, funding for that is okay though? Because I mean, we haven't talked about funding for that, like,
I think
ever.
there is a request for some escalation, but that part is being negotiated right now.
Oh, and then sorry, one last one. And then the move from the for the request this year, the CAP, the 1.72, that's partially for the move of the kitchen.
Yes.
Is that because CJRI is moving into that other space, or is it just because you guys are gonna move them anyway?
No, it's been a project that's important to us for a long time, but it's piecemeal, right? It's moving dietary into the Young Building. If you look at the framework of the Leahi campus, the Young Building where all of our long-term care operations are situated is on one part of campus, and the kitchen is on the bottom side of campus. And then the way that the meals get transported is they're completed and then they get loaded into a cart. The cart comes all the way up to the elevators in an open air, walk a pathway, and then they get delivered to all the different floors. But the idea is it's important to have it in the same building. One, because temperatures are important. It's easier to just go straight from the kitchen up to the floors. Another thing is access. I mean, if there's a natural disaster that happens and closes off the walkway, it's going to be very difficult to get the meals from bottom of campus to the top.
Is the CGRI rental space gonna include the old kitchen space too then,
Not
on their side?
not in phase one. Their phase one would just be the entire second floor of the circular building.
Okay, thank you.
Additional questions? Yes, sir?
I have just one. I wanted to ask for the Rural Health Transformation Program, that federal funding, I was wondering how that impacts you folks, hopefully positively, and when that might kick in.
Well, let me start off with the status of the program. So you know how I got awarded about under $189 million overall at the state for the program. The request is much larger, obviously. So I think right now the state is going back to CMS, or Center for Medicare Services, to get the revised budget approved. And I think CMS needs to approve that revised budget by January 30th, I believe. So once that happens, then they has to set up a process for people that want to access the funds to apply for those funds, kind of like a grant, similar process, probably similar to what they did during COVID for the ARPA money. At this point in time, there's several buckets, as you know, in the Rural Health Transformation Program. A lot of it is more general, like statewide benefits for the rural communities, but there are provisions in there for electronic health records transformation for those schools that are not yet on the EPIC electronic health record system. There is some money for to help implement that for hospitals that are not on EPIC and for federal qualified health centers not on EPIC. So we have two facilities right now in Kauai region that are not on Epic, so they could potentially access some of that money to help defray some of the cost of that. Obviously, it's gonna be a small portion of what the total cost is, but Epic is a very expensive system, but every little bit helps. And there's also part of that electronic health systems funds are funds available for enhancements to current electronic health records. So there's money available for that as well, so we may be able to access that. Exact dollar amounts will depend on, our application, how good it is to the state and, whether they accept it or not. So I can't give you a total dollar amount that HHSC is gonna get at this point, but that's primarily where the more direct benefits will be. I think there will be a lot of indirect benefits that will come to HHSC and the rural communities just because of the other pockets of money. Primarily workforce training programs, those kind of things will be very helpful.
Thank you, Chair.
Go ahead.
Thanks, Chair. Building off of Rep. Martin's question, has HHSC been identified as one of the programs? And I'm only asking because Department of Health was driving one of the initiatives.
For the rural health transformation.
Yes, sorry.
Oh, okay. Well, the good thing is we were involved in the electronic health record subgroup that was working on the application. So we did have input into that portion of it. So that's been something that we've been involved in throughout the whole time. As I mentioned, they've Hilton Rathel, or the Healthcare Association of Hawaii, has been pretty much the representative for the hospitals across the state in terms of input into the Rural Health Transformation Fund grant. So again, at this point in time, we don't know exactly how much it's gonna be, but we did have input into a lot of the electronic health record side of it.
Okay, perfect. And within those 6 pillars or categories, I'm recognizing that medical systems would actually touch 3 of those 6 buckets, as everybody's calling it. Has there been any further conversations between you, governor's office? I'm only asking because we have a huge hole
Yes.
in our budget, and we're trying to understand if these funds will help kind of offset some of the programs that we have, especially in healthcare. Or is it Hilton, like who's gonna be taking the lead for HHSC in those conversations?
We'll definitely have input through the governor's office. I've been in contact with Will Kane, his senior advisor, about a lot of things. In terms of can it be used to offset some of the losses? It's not intended to be used as an offset to operating deficits, unfortunately. But like I said, it does help the infrastructure to put in place so that it may help us in our certain areas like recruitment, workforce development down the line.
Yeah, and I hate using this word, but it's supplanting, right? We can't unring the bell, but for future programming, we can try and offset. Okay, thank you so
Sure.
much. Thank you.
Members, additional questions?
Chair,
Yeah.
I just wanna clarify, is Kahuku coming up or do we ask questions about that now?
You can, well,
Kahuku?
If Kahuku is available to come up, you have no
Okay,
further
come.
questions for me.
And I'm interested because Kahuku is where I went to school and my family's there. So I'm kinda watching what goes on there, cause the health of that facility is very important to me, I know the importance of it. Last year you came in with a whole bunch of CIP issues that needed to be addressed, did some of that get taken care of?
It did. We have been grateful. We received a good portion of CIP. And one of the challenges we have is we always try to attack which ones do we want to, which are most critical. One of the things that's been most critical for our operations, besides just the maintenance and the fixing of some of the plumbing or the generator that we just replaced, looking at our EHR, getting to Epic, because that just is the foundation of everything we've done. So we have been grateful in the past few years. We have received more funding than we received in the past. And I feel that we've been really good stewards of what we've received. Is something that as we go through and look at the needs that we have, what are the most critical and what do we attack? And we are in the middle of a number of projects right now. Part of it is the renovation and fixing of a building that hasn't been touched for 100 years. So giving it a little bit of a TLC, a beautiful hospital will bring more people, and it equates to the beautiful care that we offer. So we have received some funding, and we've been grateful for that.
Very good to hear. Thank you so much for that.
Thank you. Additional questions? I have a quick one, maybe not specific to, well, definitely not for Kahuku specifically, but I think over my time here, there's been a lot of talk over kind of frequent visitors, frequent flyers to the emergency rooms. Has there been any progress? I know at the time, there was a lot of talk over the community paramedicine program as a way to kind of intervene prior to having that great need, but are we tracking, those folks and kind of how they're going through the system and whether there's actually been any progress in preventing, those folks who are in the ER, 50 to 100 times a year in some cases?
Yeah, that is a great question. I think that a lot of it takes place in the community, and I'm trying to hit a lot of things off in the past. With our I'm not going to say old timers because I'm one of those now, but just educating, trying to help our younger generation. I think the younger generation gets a healthier living, but trying to change that lifestyle all of a sudden with our kupuna, they're going to do what they want to do, and so you'll still get those. But I do see a community that's more aware of their health. The ones that we see come through and through again, they struggle with behavioral health, with maybe drug addiction, and they keep hitting the system. The unfortunate thing is for some of these patients, we can't keep them for ourselves. They might to the acute. They might have to be transported to maybe Queens or another hospital that can handle that. We just don't have the facilities for that at this time. We get over 800 visits in our emergency department a month. So it's a pretty heavy place with a very limited amount of space, and then with the housing projects and the development projects that are happening on the North Shore, we get hundreds and thousands of visitors. Of course, we know, and then on any holiday, we'll see everybody from town coming down to our side, and you'll see all of us going up to town because we're so excited to get to the other side of the mountain. But we have a lot of visitors, and so we see that traffic going. But as far as the repeaters, it's always a challenge because they're the hardest to place, and then it just costs our system so much. And I think that that's going to be an ongoing challenge until we can hit our younger generations with healthier living.
And does the HHSC track anything like that, kind of aggregate data system-wide?
I think with the advent of with the Epic system, I think it'll be a little easier to get that data. But I think right now, because we are operating on several different platforms, we don't have a system-wide poll.
Yeah, because I like my memory serving under Chair Morikawa, my first couple of terms, in the health and human services bracket, is we had like a homeless individual who had cost the state about $1 million in 1 year in ER visits, right? So I was just kind of curious, like if we have anything, but that would be helpful, and hopefully, kind of going forward, something maybe we can track and make progress on. But Brusela, did you have a question?
That was my question.
Oh, okay, nice.
Thank you.
Anyone else? Okay, well, thank you very much for your time, for making the trip, especially for those of you who didn't have the opportunity to speak. We'll call it an opportunity. Thank you very much.
Nice framing.
Yeah. We're gonna recess briefly, and then we're gonna reconvene with the Department of Human Services. This afternoon, we'll have Judiciary, Department of Budget and Finance, and DLNR. So recess until we have Human Services ready to go. Recess. Aloha, we are reconvening the House Committee on Finance for budget briefing from the Department of Human Services. Whenever you're ready, go for it.
Okay, thank you, Chair, Vice Chair, members of the committee, Chair Martin, Ryan Iwani on behalf of the Department of Human Services. Again, want to thank all of you for the ongoing partnership and working together. So today we'll just briefly go over the department, some short accomplishments, and then go into Q&A before people like Kyle who's listening runs down here and asks questions, right? So just that you know, the department, our vision is the people of Hawaii are thriving. Our mission is to encourage self-sufficiency and support the well-being of individuals, families, and communities in Hawaii. Just wanted to highlight, we provide the vital benefits and services that act as building blocks for individuals and families in need to support self-sufficiency and on their own terms. So our department, we have 6 staff offices, 4 divisions, 4 administratively attached agencies, and 4 commissions. So our staff offices are Fiscal Management Office, Office of Enterprise Technology, Human Resources, Budget Planning, Management Office, Administrative Appeals Office, and Audit Quality Control and Research Office. I'll introduce some key members later. We have 4 divisions: Benefit, Employment, Support Services Division, or known as BESD, Division of Vocational Rehabilitation, MedQuest Division, Social Services Division, or SSD. We have administratively attached agencies: Hawaii Public Housing Authority, Office of Youth Services, State Office of Homelessness Housing Solutions, and Office of Wellness and Resilience. And the commissions that are with us are the Hawaii State Commission on the Status of Women, Commission on Fatherhood, Hawaii State Youth Commission, Lesbian, Gay, Bisexual, Transgender, Queer Plus Commission, also known as LGBTQ plus. And then we have councils: State Rehabilitation Council, Hawaii Interagency Council on Homelessness, Financial Assistance Advisory Council, and the Wellness and Resilience Advisory Board. Just want you guys, to highlight that our mean of financing for FY26 is $4.7 billion. In A funds, it's 1.4, and in N funds, it is 2.989. So 3 round up, right? Okay. Just to highlight, we have 2,323.5 positions. 98 of them are temp, and we expect to reduce that to 89 in the following fiscal year. We currently have 663 vacancies. Last year when we came before you guys, we reported that our vacancy percentage was about 33%. This year we are about 27%. Our leadership, myself, as you hear, we have to my left Deputy Director Joe Campos. He'll be able to answer questions regarding Kalaio'ola, Pu'onane, and the Hawaii Emergency Food Assistance Program, as well as other programs that he's involved with. We also have Deputy Director Trista Spear. She could talk about the Disaster Case Management Program, the Rental Assistance Program, and her leadership if need be on areas like SSD. We also, for staff offices, we have Carolina Agran, who's our BPMO, our Budget Planning Management Lead. We have Sheila Joy Olapani, who is our Fiscal Manager. Jennifer Muruoka, who is our HR Manager. We do have Trisha Oftana, she's working remotely currently. And we have others from the Director's Office. For the Benefits, Employment, and Support Services Division, BESD, we have the 2 Scots, Morishige and Nakasone. For Social Services Division, we have Acting Administrator Eladine Olivao and her team. For MedQuest, we have Acting Administrator Meredith Nichols and her team. And then the Division of Vocational Rehabilitation, we have Leo Diaz and her team. For Hawaii Public Housing Authority, Hakeem could not make it here for medical reasons, so we have Ben Park here to answer any of your questions. Office of Youth Services, we have Leanne Gillespie or her team. I think she might be out as well, so Mimari's covering. For For State Office of Homelessness and Housing, we have Jun Yang. Office of Wellness Resilience, we have Tia Hartsock and her team. And then Commission on Status of Women, Yasmin Cheney, and then again, we have our commission. So just real quick before we go into QA, one of the things we did wanna highlight, we had some successes throughout the department in 2025. We started the Kako'o program in SSD, which provided unannounced visits with food boxes for food security. We've done it on all islands. We have the Hawaii Emergency Food Assistance Program, which was started due to the shutdown with the $250 per person. We have the Hawaii Child Wellness Incentive Pilot Program that was actually started by the legislature, teamed up and supported by the governor, and which was implemented to encourage wellness checks with $50. So thank you to both chairs for your support on this. We have the Sunbucks program or summer EBT. First Lady was very instrumental in pushing food security. So that has been ongoing. And another thing that was led by partnership with you with our Lieutenant Governor was the Preschool Open Doors program. So we would like to highlight. Okay, and I know there might be a couple of questions, so Chair, you okay? We can move into Q&A,
Sure.
or we can adjourn and call it a
I
day
mean,
today.
I'm tempted, honestly. Nothing interesting going on this year at HHS, right?
Not at all, yeah.
I have a couple small questions and then we can move on to the committee. Maybe we can speak on the SNAP error rate and just kind of give us an update. I know you guys are making just phenomenal progress, but I think it's been a few months since we checked in, so wondering if we can get a brief update on that. And maybe, because I don't think you quite touched on it, but I know it's in your packet, maybe touch on some of the potential fiscal implications if things get out of hand.
Thank you, Chair. My name is Scott Morishiga. I'm the administrator for the Benefit Implement and Support Services Division, BSD. So, our staff have continued to make great progress in bringing down the payment error rate. The last year that we have full complete finalized numbers for is federal fiscal year 24. And in that year, our payment error rate was 6.86%, which was brought down significantly from the prior two fiscal years where it was over 20%. The way that the error rate works is FNS doesn't typically finalize those numbers until June, so we won't get the numbers for federal fiscal year 2025 until probably June of this year. And so for the error rate, there is an impact because of the One Big Beautiful Bill Act, or HR1. We're starting in federal fiscal year 28, that's starting October 2027. Based on what our payment error rate is, the state may have to pay a portion of the federal benefit that currently is 100% federally covered for SNAP that goes out to clients and community. Based on what it has been for prior years, that amount would be anywhere from about roughly 690 million a year total that's paid out by the federal government for SNAP benefits annually. And if our error rate is above 6%, we would have to pay a certain percentage of that based on how high it is. For federal fiscal year 25, I think before adjustment and finalization of the federal government, I think our error rate was about 10%, but I do want to caution that that number can be adjusted down. So even in the prior fiscal year, where the final number ended up being 6.8, it was a little bit higher than that before the adjustment. So I just want to provide that caution. The other thing to keep in mind is, despite our staff's efforts, there have been a number of changes that have made it challenging for our staff to move forward, and that's partly implementation of the provisions of the OBBBA impacting SNAP, because unlike in some other areas where there's a ramp-up time to implement, for SNAP, USDA has notified us that the changes resulting from the OBBBA were effective as the date of the signing of that bill, which was on July 4th, 2025. So, I think that has impacted the error rate initially what the numbers were for federal fiscal year 25, and likely that combined with the impacts of the federal shutdown might have an impact for federal fiscal year 26. One thing to keep in mind is for that first year where the error rate could impact the amount we pay for benefits, the state has the option of choosing between the error rate for federal fiscal year 25 or 26. So we'd have to look at those numbers and we can make a decision at that time, what year we wanna be the reference year for that.
Okay, and then kind of, given what's at stake and how this thing can escalate so quickly, do you have, resource-wise, please reach out if there are things you need to kind of meet that mission, continue your good work. It seems like kind of a drop in the bucket, given this could easily cost the state tens of millions of dollars on an annual basis. So feel free to just kind of double, triple down on that as we get through our budgeting process. That'd be helpful.
Okay. Thank you, Chair.
And then another small one, well, I guess there's no such thing as a small one. Actually, does anyone else have questions specific to SNAP while everyone's seated? No? Okay, I have a brief question around MedQuest and eligibility verification, and I was kind of curious. I think when we last spoke, I guess the big concern was the department's ability to really scale up hiring for positions that may not pay very well. And maybe it's a mix of that plus contract hires, but how's progress been given the increased workload that's been kind of placed in our laps by the feds?
Thank you very much for the question. In terms of hiring, it is difficult to hire into these positions, especially as the work increases. You've all seen the exponential growth sort of in MedQuest membership during COVID, and we've been slowly unwinding since then. We grew by about 140,000 members during COVID. We've come down now by about 81,000, so not quite at pre-COVID levels. So still a lot more members, which is good, a lot of people getting covered, but having enough staff to really work alongside these members to help them maintain their applications is a challenge. So we have been interviewing, hiring, but then once you hire, we also have the happy challenge of training our new workforce to make sure they're up to speed, and especially to handle the new requirements with HR 1.
Okay, yeah, so, go ahead.
So Chair, so we have made a coordinated effort through our HR department, so we've been participating in a number of job fairs. We've been looking at working with, continuing to work with DHERD on looking at our position descriptions. We're also looking at different avenues. We've been working closely with Gov's office, so the budget in the governor's package reflects the added increases that we need, both for BESD and for MQD, actually for our whole department, regarding participation, anticipating potential changes. So our budget, even though it is increasing, it's clean in the sense that we're not just adding on to add on, but it's doing that in preparation to address the influx of additional warm bodies that we will need, additional training to do that to support the whole department. And so the budget that's before you reflects the needs that we anticipate going forward, especially for the next 2 years with the impacts from the feds.
Okay, thank you. Members, questions? Rep. Peruso.
I have a question, I think it's for the director. So given that we
She wants to hear.
no, thank you.
She said director.
I'm sure there'll be more. I'm sure there'll be more questions.
ahead.
Given the new Medicaid eligibility rules and the expectation that about 19,000 to 38,000 adults will lose coverage as a result, has the department done any modeling around how that shift, that loss of coverage will affect hospitals, emergency rooms, maybe uncompensated care, and if you have done modeling, when could we expect you or ask you to share it with the legislature?
So I don't know the specifics regarding what you mean, like the modeling, if we ran numbers. We're still in influx waiting for the feds to come up with promulgating the rules, all of that with the potential impacts. We just, lived through a shutdown that impacted everything. So our people are constantly monitoring what's happening with the feds, if the portals are open, those impacts. We've been working closely with the Gov's office and budget and finance on potential impacts regarding, liabilities, our team, both deputies and our fiscal FMO and BPMO offices, have to on a dime, be able to move money around to prepare, right, with the delays with SNAP and all this stuff. So we are looking at that. However, because of some of this uncertainty from the feds, we are at the whim of these updates, right? Even with these, demands for access to data, what's happening in some of the other states. So we can, we're more than willing to meet with you to share with what potentialities, but again, we don't like to just, put out all these various scenarios until we get a clear idea what the impacts would be.
I appreciate, quick follow-up. I really appreciate that, because we're living in an age of such uncertainty. But I do think that there would be value to doing some proactive work. And I feel like we're in a very reactive kind of space right now, and I would really like us to get ahead of it in a way and get our arms around what's happening, if we can start to see the patterns. And I guess my question was really just asking if that work is best situated in your department, or if that's something that we should be asking about, maybe SHPTA, or I don't actually know like who is best positioned to do that kind of analysis and thinking.
So our budget requests reflect what we predict we will need in order to, with the various scenarios, right? And so the position, counts and all of that, the money we're moving, some of that was in response, but also in preparation. So that's our best guess on what to expect. So we're trying to get that now so we can, ramp up. Regarding other things we've been working through Gov's office, because some of those things, as you mentioned, go over multiple departments, right? Even though we're a partnership with, let's say, Department of Health, as you know, this impacting DOE and various things. And so I guess it kind of depends on how wide breadth you want that modeling. We can meet with you, to go over the specific program impacts. We've met with Chair on that regarding specific impacts on, let's say, divisions. She's called meetings with multiple divisions to see how that overlays. But right now, because of how things are so fluid, they're doing their best with working all around the clock, trying to prepare for
No, and I
unexpected.
appreciate that. I really, and I appreciate the work of the whole department. So you are doing heroic work right now. So thank you.
Thank you.
Thank you. Members, additional questions? Rep me off.
Thank you, Chair. Maybe this question is for Deputy Director Campos regarding the Maui recovery. First off, thank you, Deputy Director, for all your assistance with Maui County and the recovery efforts with the Lahaina wildfire. Do you have any update or like with the FEMA funding possibly? I know the county asked for an extension, but any plan or challenges that if it doesn't get extended, like what's the fiscal impact for the state?
Sure, and actually I'll ask.
I'll step off the table and then bring up.
You're welcome.
Yeah.
Deputy Director Trista Spear is working very closely with the county as well as the Office of Recovery and Resiliency. It might be Resiliency and Recovery, I never remember which R goes first. But she's probably best to answer that question.
Good morning, for the record, Trista Spear, Deputy Director for the Department of Human Services. Thank you very much, Representative, for the question. We're happy to have been able to play the small part that we did in assisting the community in response to those unprecedented wildfires. We are working in conjunction with the Governor's office the Hawaii Office of Recovery and Resiliency, as well as HIEMA, alongside with the county. The request for the 12-month extension for the FEMA direct lease and other FEMA interim housing programs was from HIEMA to FEMA. We are still, as of last night, in close communication with FEMA. We are told that their decision as to whether or not to grant that 12-month extension for those multiple housing programs is currently resting with Secretary of Department of Homeland Security, Secretary Christy No.
If Secretary Noem does not grant the extension, what's the plan?
So we've been working closely with the county to identify what that plan is, what that would look like, learning from all the various work that we've done since August of 2023. At this time, we have not identified exactly what that response would be. That's hard to sit here today as a type A planner and not be able to roll out an answer, but that is where we are at. But the state and county, the governor, the Department of Human Services, and the County of Maui, we are all committed to working with the critical programs to continue to support these needs of the survivors. So for housing, we don't know what the answer is. We are really thankful though, however, the county has indicated that they recognize the importance of the disaster case management program that the Department of Human Services stood up with the FEMA grant, and the county has indicated their commitment to fund that program starting in August of 2026. So they have identified fiscal ability to do that program in August of 2026, which, as you know, currently there's over 4,000 individuals, over 1,600 cases that are currently active by that program. That program has matched survivors, the nearly 7,000 survivors served total since the fires, or since the program launched in November of 2023, with over $160 million worth of resources, non-federal resources, I should say. And so right now that program is slated to end February 10th of this year, so in just less than a month's time. We have asked for a 6-month extension from FEMA for that grant. It's a no-cost extension. That is the maximum amount of time that a period of performance under this DCMP grant could go for. And we're very thankful to the county for their recognition of the importance of this program and continued fiscal support of it, with continued DHS technical assistance and support so that that program will continue.
And there was a 2-week extension from February 10th through February 20th
For the housing
for
programs.
the housing program.
Yes.
So that'll give us an additional 2 weeks to
Yes.
work on planning.
And I just wanna be clear, because I know there's more people watching this hearing than just this room. We do not have a funding source identified for the disaster case management program between February 10th and August, when the county is able to begin, when they would have funds available to begin funding. So we are hopeful that we would receive that extension. Again, that extension is pending FEMA's decision, and right now, our DCMP team is currently, I believe, on a call with our assigned FEMA grants team, so we're constantly hopeful that we'll receive a positive answer on that.
Okay. Is that included, is that potential fiscal impact included in this budget now, or?
We have not included any fiscal requests for the disaster case management program in the department's request. To date, that program has almost completely been funded by the federal grant or private donations. We have only, in the 2.5 years since the program's launched, I believe it's less than $5,000 of state general funds that have been needed for this disaster case management program. State funds, $3,021.54.
Thank you, Deputy Directors. Thank you, Chair.
Chair Martin, any questions?
Yes, please.
Mhm.
I guess more of first of all, I really appreciate seeing all of you here and the incredible hard work and resourcefulness of this department in really challenging times. I wanted to ask a bit, as you know, we have an initiative to increase the contracts for direct service providers across the board. The True Cost Coalition has been advocating for this, and we did have a bill last session which this committee passed, but didn't quite make it into the budget at the end of the session. And so I wanted to ask a little bit, maybe bring up the Office of Youth Services as an example, to ask a bit about what the situation is with those service contracts. I know how important they are. On the way here, I had a constituent call me while I was driving who called his IHS case manager an angel, who had showed up 12 hours before he was to be evicted. And he's right now in a transitional kauhale situation, but he is kupuna and he has never been homeless, and he is not homeless, thanks to the hard work of our direct service providers. So I know how important they are to do the work of the state. So I just wanted to hear a little bit about the budgeting process and what the situation is, just so that our finance committee, which will have to consider these kinds of measures, understands what's going on.
Thank you, Representative and Chair. My name is Mimari Hall. I'm the Program Development Officer at the Office of Youth Services. I'm here on behalf of Executive Director Leanne Gillespie, who is away today on business. As it relates to contract services, Office of Youth Services overall has not gained or recovered some of the lost funding in the past. So we're in some ways stagnant in terms of the budget. So while our responsibilities to improve, enhance, and expand in community services to keep youth in the community as much as we can, instead of bringing them into the facility and touch the further deeper into juvenile justice system, has been challenging. And the budget process that we implement really look at what are the service needs, what are the gaps, and also looking at the service numbers for the past contract years and allocate to maintain the service in the community and continue rather than reducing or eliminating certain services. And that also goes through the procurement process to start the contract. So there are some challenging processes on our end as well. Instead of just simply contracting, we have to go through that state procurement process for services.
And I guess what I was getting at was whether you have been able to increase the amount paid with those contracts to keep up with the rising costs that nonprofits incur to deliver the services, whether you have in fact reduced the amount of your contracts.
So thank you for the thoughtful question. We have not been able to increase the cost or the budget for services. And again, looking at the overall budget and certain funding that we receive from the state legislature may be dedicated to certain services. So while overall OYS may have had an increase in overall budget, but that may not be allocated across all contracts. So the answer to your question is we haven't been unable to increase contract budget.
Okay, thank you, Chair.
Thank you. Vice Chair?
Can I ask a follow-up on this, I guess, kind of conversation around the True Cost Coalition or the conglomerates of, nonprofits have been asking us, and not specifically to your branch, maybe sorry to the director or to everybody in the room who does contract out services. I've gotten a sense in my conversations, that I'm not sure if there's a disconnect happening between the conversations everyone is having with the service providers and what's necessary for them. I mean, I hope you guys are having those conversations because we are hearing from these groups that, some of them are on the verge of not being able to still continue at all because of largely the level of money giving to the contract, but I don't know if I felt the same kind of direction or pressure from the department to let us know that we're on the verge of losing critical services in the community. So maybe more of a statement, or are those conversations happening? And what is the department doing to renegotiate those contracts to make sure that we are able to keep our service providers, you know, in community to do this work? Is there a disconnect happening between what we're hearing from them and the department, or are you guys in the process of retooling this given like the level of, I guess, publicity that's been happening with these questions in the last couple of years?
Okay, so regarding first I would like to say we value our partners, our community partners, our vendors. We can't do everything, so having these contracts and scopes of service to be able to service people throughout the state is vital. So when they are suffering or hurting, and we are aware, it does impact our ability, to do service. Chair Martin, I think we briefed a little bit for Finn, but we encountered a situation with child welfare a few months ago where significant cost impacts potentially could require thousands of kids to come back and us to have to deal with that. So we are in contact with our providers, but there's a process and a lifespan for these ongoing contracts, right? So we go out to bid, we're following the procurement rules, and so even if we are able to, let's say, add a scope or expand the costing of a project, if it goes at a too high a limit, it would require us to rebid and then open that process. And many times our partners don't want to do that, right? Because it's a process to have to resubmit everything, posting and all of that. So I would like to tell you that we have very good relationships with our vendors. We are aware that we would love to pay them so that they are sustainable because they do the service. In fact, we would love to have more services out there in our community, but we are facing some budget restrictions and we don't have all those resources. So if we have a limited resource, if we pay more in one area, that means another area will have to change, right? And so it is that I can attest that our divisions and our attached are very keenly aware of their fiscal responsibilities and trying to balance. Many of them have asked for budget increases, to address this, but it requires also that relationship with our vendors to explain to us what they're facing, what is a true unit cost, why, if there's a need to relook at the scope for the expanding thing that requires a discussion. And if it is now with a changing environment, it might need to be then reopened, right, as a competitive reopen process. So there are those ongoing things. We have responded for certain key areas. When we are working. We have vital person that works very hard. Donna working with all of our divisions regarding contracting, working with our SPO and doing that. So I would tell you, if vendors are facing that, please reach out to our divisions to explain to them what they're facing, so that way if we do need to reopen it or rewrite the scope, that we have more knowledge on that, so that way we can better address the population in need.
Thank you.
Members? Yes, please.
So I understand from conversations that you folks did the research with your AG person that a new RFP would not be triggered unless there was a contract increase of 25% or over.
I think it's actually lower than 25.
That's what I was given in writing.
Wasn't it like? Okay. Well, we'll check into that number.
Yeah, so that is what you folks provided me in writing from the AG's office. And so I just wanted to clarify that we're probably not talking about triggering any new RFPs with the types of increases that might be discussed.
So I think when the ledge did provide more money for contracts, the department did implement those increases, right? That we could. So again, if that does come to play, we will do our best. Again, if our providers are able to have those resources so they can ensure that the people of Hawaii are serviced. That's in our benefit, right? That's helps them, helps us. We look at it as a partnership. We want our vendor, our partners to thrive as well. However, we also have that very tight responsibility fiscally to report how we have our money, what we're reporting to, and then also that you guys are aware. So feel free, if you wanna increase my budget by 25% more, I'll take it, I won't turn it away, but that's your guys' call.
I got you, I'll write that down. Members, anything additional for the department? Okay, Rep. Yamashita?
That would be done before he talks. So.
Hey, he came down just for you, don't worry.
So just a couple of things real quick. I think just so that we have the same information, I monitored your hearing with WAM, and they did request some information. If you could send the committee some whatever you're sending, then that'll be very helpful.
Sure.
The other thing that is and this is I'm not saying it doesn't happen, but it's not normal where because we do that to you also, where your CIP request is doesn't have the kahales and then the governor's does. And so I wanna know what the thought process of adding that is, and then also that is there gonna be operational cost increases to add more?
For specifically for
the kahale.
Morning, Chair. Good morning, representatives. Jun Yang with the office, statewide office on homelessness and housing solutions. The CIP request that is coming through the governor's administration package includes $10 million. It is monies for some of the building of kauhale or kauhale-like projects in a number of areas. It does not include operations funds for that yet, because those are still, since the CIP budgets allow for planning and building, and it may take a little bit of time. At the time, once the buildings are facilities.
Do you have projected amounts of how much it's gonna cost?
We still are working with the different counties.
I think that'd be helpful for us to know before we appropriate the money with the operation.
We'll make sure that we bring that to you.
Okay. Thank you. And then in previous there were some discrepancies as far as operational costs for kauhales and what was in the operating unit. Is there still
the discrepancies on the operations? We do have a request for $8 million that includes for what was that again?
For the current ones.
Yes, for the current ones, yes, for Honu and for the medical respite ala.
Right. Okay, thank you.
No trouble. Members, additional questions? Okay, Rep. Hartsfield?
I have one. First of all, I respect the department and everything you do for the community. My question comes as an attorney, so I'm hoping that the department is prepared for any type of possible expenses related to settlements, litigation awards to plaintiffs, fines, or any type of monetary sanctions for non-compliance, because I know if you don't prepare for that, it could skew a budget. So I just want to make sure you guys are okay and that you're taking that into consideration.
So I would tell you yes. So again, congratulations. It was a nice event on Monday for your appointment. So yes, we are aware of pending. We've been working very closely with our Attorney General. So we in regards to that, it's difficult because again, going through the process, there's different stages of lawsuits and litigation. Some get settled, some get dragged out for a number of years. And when those come in, we work with our Attorney General and our budget people to submit it for consideration. So we are aware of those that have been formally filed, and we plan for that in our overall budget. But until those issues go through that process, nothing is, those amounts can't be accounted for. But we are doing our best to, prepare, one, to try to eliminate and reduce those kind of situations, but also working partnership with our attorneys.
Thank you. Brett Temple?
Thank you, Chair. Thank you everyone for being here today. My question is on public housing. Back in September 2025, there was 4 gun violence incidents at and around KPT, and as you know in the news, the safety around public housing, I guess mainly in the urban core area, is ongoing. So my question is, how is your department and HPHA and the city administration and our governor's administration doing to address immediate safety concerns and the causes that is causing this?
Thank you, Representative, for the question. My name is Ben Park. I'm with the Hawaii Public Housing Authority. Director in Safi sends his apologies for not being able to be here today. So how are we working to prevent and to address violence at our public housing communities? I'll say this, that it's a pretty big effort. We are working with a governor's office, we're working with the FBI, we're working with Department of Law Enforcement and HPD, Crime Reduction Unit. We're working with anybody and everybody who is offering help. And so when it comes to some of the things that we're gonna do to address these issues, we've been in talks about getting more cameras. I know there's drones for fireworks, so there may be some other uses for those drones as well. There's also potential software to triangulate gunshots through the sounds that they make. Also increased patrols, also cooperating with our Department of Attorney General's office and the prosecutor's office. So it's all hands on deck when it comes to violence, and it's not just endemic to public housing communities. Crime is happening everywhere, but we're focused on addressing those issues. Hopefully we'll get back to you with some updates.
Is there any underlying causes that are driving these incidents?
Well, I think when we met with your staff, we had a meeting at KPT. And I think at the time, the community policing officer, I think his name is Brian Owato. There is a bunch of gang violence going on, and we're trying our best to address it, and working with our families and the parents to try and see if they can also help us curb this violence as well.
And sorry, can I continue? And is there coordinated efforts with Kamehameha Valley Homes and Mayor Rights?
Yeah, they're all with our staff offices, and so I don't know if I can go into the in the weeds on what we're doing, but I'd be happy to talk to you about it after.
I would appreciate an update. Thank you. Thank you, Chair.
Thank you. Rep. Russo?
Thank you. I have a question for Mr. Yang. And it's been a pleasure working with you, and thank you for coming to our community events and talking about community wellness with us. My question is about the contracts with Kealoha and in general, the service provision around our unhoused community. I'm only really familiar with Oahu, but Kealoha has 2 service providers in our community once a week, and it seems to me to be a really thin coverage, given the amount of people who are struggling with housing insecurity right now. So, and they're also managing a couple of shelters. And I'm wondering if you can share with this body a map of the number of specific providers that are allocated for each community. I mean, because I only know because I was asking, trying to figure out like exactly how much support are the unhoused getting in our community.
Absolutely. I believe, let me first start by saying that the contracts for our outreach service providers, it does not come out of my office, but it can work together with our department, homeless programs office, and make sure that we have this information for the committee and for
Thank you. I appreciate that.
Okay. Anything additional? Okay, Vice Chair?
Sorry, June, sorry.
No,
Just
right.
a couple follow-up questions about the budget request for the Kauhale that is in DHS's section. So the $8 million that's requested, that's only for the 2 sites listed in testimony, only for the medical respite and the HONU program.
That's correct.
How much is there a breakdown, how much for each?
It's about 2.6, almost $3 million for Honu, and then the remainder for the Ala medical rep.
And what's the current allocation that has already been provided in the budget for each of those sites?
For the Honu program, it is $2.625 million, if my recollection is correct. And for the medical respite, it's an ongoing operations of about $5.5 million. I think our last contract with them was for about $6 million.
Okay, and is this because of the operating cost? I know the medical respite operates at a higher level because of the level of care being given. Is it just the cost to bring the medical services in?
So it is. Currently, there's about 62 spaces at the medical respite. These are individuals that would most likely be in our emergency rooms. And so this is an actual reduction in cost for services for emergency visits comparatively. So what we're doing is bringing people into the medical respite facilities, being able to triage and work with the issues, their health issues, and connecting to healthcare and insurance as well. From there, they're able to transition to Kauhale units and other placements as well from that point. For Honu, in about a 7-month, just a snapshot, they've served over 1,000 people at any given time, and so what we have seen is that Honu as a triage service for our Oahu communities has done a great job of connecting individuals from encampments and places on the beach and other places into our emergency shelters, into our kauhales, into our homeless into permanent housing from that point on. These both have been very, very successful, and we hope to be able to continue them.
How many patients have we, or individuals I guess, have we cycled through the medical respite?
I can get that information to you. And just as clarification, these are all, these 2 programs specifically are in partnership with the City and County of Honolulu. They are the operators of these 2, the contracts are coming out of their office.
And actually, since we have you up here, this question came up. I asked HHSC, the site that CORE is running out of Leahi,
Yes.
Is that a Kauhale or is that a CORE program?
So I did get a chance to speak with the gentleman afterwards. The Leahi facility is it is a city contract that has been funded by the state through my office. So he may not have been aware that our funding was a part of the one of our contracts to serve for medical respite in the Leahi facilities. So it is a joint, again, this one is another joint project together with the City and County of Honolulu.
Okay, okay, thank you, yes.
Chair Martin?
I just wanted to ask a follow-up. So how did we get the numbers wrong on these city contracts for the medical respite and Honu when we did the budget last year?
I think as a part of, in the transition, there might have been some things that we may have been a little bit off on the numbers for this. Working with the city and county, we wanted to make sure that we got everything right this time. So we appreciate the opportunity to make this request.
Okay. Any other questions for the department?
Yeah, this is real simple. So the Maui wildfire, right? All the prefab units and all the different things, and some were placed, some were stored, stuff like that. Can you just send the committee an inventory of where everything's at? You don't have to answer right now. Just send us the inventory.
Oh, I can answer right now if you want.
Well, yeah, okay. But I want it in writing, where you just send us where everything is and where it's placed and who's using it and.
Yeah.
Okay.
Thank you, Director. I'll send it to you.
Thank you.
Perfect. Okay, any final questions? Do you have a question, Reverly? No, you're good, alright.
Thank you.
Okay, so the plan is we are going to adjourn and we will be reconvening at 1 p.m. in room 308 with the Judiciary, Department of Budget and Finance, and the Department of Land and Natural Resources. Thank you for all your hard work and thank you for your time. We are adjourned. Aloha, we are convening the House Committee on Finance for budget briefing. It's 1 o'clock, January 15th in room 308. And we are joined today by the Judiciary, and they'll be followed up by the Department of Budget and Finance and Department of Land and Natural Resources. Please proceed.
Good afternoon, Happy New Year, Chair Todd, Vice Chair Takenuchi, members of the committee. My name is Brandon Kimura, Administrative Director of the Courts. With me today is Deputy Administrative Director of the Courts, Dalen Heather, and other administrators of the Judiciary across Oahu and several from the Big Island as well. So, thank you very much for having us and the opportunity to present today on an overview of the Judiciary's supplemental budget request. As you are aware, the mission of the Judiciary as an independent branch of government is to administer justice in an impartial, efficient, and accessible manner in accordance with the law. We do that in a number of ways through our courts of appeal, circuit, district, and family courts, which includes our specialty courts that are listed on this slide, or several of which are listed on this slide, that are more focused on assessing and addressing the underlying issues that brought folks into the justice system. We also address access to justice, which is an enormous priority of the Judiciary, through self-help centers is one example where we, through the collaborations with the Hawaii State Bar Association, have been able to serve upwards of 40,000 individuals since they opened in 2011 at virtually no cost to the state. This involved over 20,000 pro bono hours of work. We also have an e-reminder system, which provides for system for upcoming hearings that anyone can sign up for, whether you are a party, a family member, a lawyer, the media, or anyone else interested in a particular case. We also have a number of offices that are public facing in our administrative departments. I'll just highlight one of those today, including the Children's Justice Center. This develops an interagency, multidisciplinary approach to investigate cases involving suspected or confirmed victims of child sex abuse, serious physical abuse, child sex trafficking, or other things impacting children. Since the pandemic began, the serious physical abuse and the children witnessing crime, specifically domestic violence, has been a significant increase in that area that we've seen at the Children's Justice Center. So I want to highlight those things for you as a little bit of background on the institution, and we'll now get to the supplemental budget requests. We're certainly mindful of the relative economic uncertainty that the state and the country are facing. We've carefully considered that context in making our requests and crafting them, and have actually been reducing them in recent months. At this point, we are firm in these as our overall requests, which will have 7 for approximately $6.44 million in general funds in FY27, conversion of 3 general funded temporary positions to permanent, and a means of financing conversion of 1 position from special fund to general funds. I'll go over each of the 7 requests and our CIP request over the next several slides. The first request is a supplemental armed private security for $3.25 million. This is more than half in dollar amounts of our supplemental request. This represents a significant, hopefully temporary shift in approach to protect and provide physical security for the Judiciary and all of the folks who enter our facilities. For decades, we have relied exclusively on the Department of Law Enforcement and their predecessor agency. And in recent years, we've added contract security that provide the wands and magnetometers that you folks are familiar with here at the Capitol as well. But in recent years, in particular, the number of deputy sheriffs that have been able to be on site in our buildings has dropped, and it's at this point inadequate to protect not only the judges and employees. We're also really concerned about the tens of thousands of people that we are compelling to be in our buildings every year. So this request would provide, again, it's supplemental, so it's not in lieu of DLE. It would be armed private security. This is similar to the federal courts model, where they have the federal marshals and then also contracted security that are armed as well. The next request is cybersecurity. This would be funding for 2 positions And one of the two positions, we would do a means of financing conversion from our special fund to a general fund. Over the last 45 days since December 1, we have experienced as an institution over 625,000 high-risk security events on our judiciary systems. Of those, nearly 56,000 were classified as critical. Unfortunately, they were actively blocked. And what classification as critical means that if they had gotten through, that would have been significant damage to either our systems or continuity of services. The next request here is restoring funding for our POS contracts for substance use disorder treatments on Oahu. Early in the pandemic, when the state was going through financial challenges and we, along with others, reduced our budgets, the POS contracts on Oahu took a significant hit. Since then, we have been hobbling along with less funding, and we've been able to serve folks, but that's just at this point completely unsustainable, and so that's why we make this request to have those funds restored. The legislature did provide some funding in recent years to restore the domestic violence portion of those contracts. So this request is to address the remainder for these contracts that are focused on substance use. The next request is restored funding for the Office of Public Guardians sole staff position on Kauai. Last session, the position happened to be vacant at the time, and the legislature defunded the position. This is a half-time position, but it is the only position for that office on Kauai. And so since then, we have had guardians initially from Oahu, and then the Big Island, and currently a guardian from Maui flies over to service the Kauai clientele. Although the Kauai clientele is understandably a smaller in volume than the other islands, we absolutely want to provide them the best service, just as we do everywhere else in the state. And when our guardians fly over, in addition to the less than optimal service that we're providing the Kauai guardians, it impacts the wards on the neighbor islands where they leave, because they have a caseload to attend to that day. Next request is funding to implement the recommendations of the Commission on Salaries. This is the exact amount that the Commission had recommended, and the legislature funded the amounts for FY26 for the first year of the biennium. This is just the second year of the biennium amount. The next request is to restore funding for and convert a temporary position to permanent and redescribe it as a court ops specialist in Kona. Court ops specialists are more or less utility positions that can bounce around as needs may change over the years. In particular, right now in Kona, the urgent need is in our fiscal office, and so this person would assist with those challenges, possibly assist us with grants going forward as we're working on grants, and in particular reimbursement of court-appointed attorneys' fees. There's also been a significant increase in the request for court interpreters, and this person could help in the logistics of that. I will say that this court ops specialist in Kona and the one cybersecurity positions mentioned earlier are just a couple of examples of how we are taking older positions that were perhaps defunded early in the pandemic and redescribing them to modern uses. That's what we're trying to do. We're coming back slowly and we believe modestly and prudently to request restoration of funding when we need it for a modern need and not just what it was before. The last of our 7 operating requests is a no-cost conversion of 2 temp to perm positions in our court-appointed special advocate program on Oahu. These are folks who serve children who are extraordinarily vulnerable in foster care, and although temporary positions in any part of state government makes it more prone to higher turnover and instability, that is especially damaging in this particular program where those children and family need the stability perhaps more than anyone else. So those are our 7 operating requests, and I can continue to CIP or
No,
share
please,
with
please, John, go for it.
Thank you. We have several CIP requests. Our first and primary is a new construction funds for a new district court in South Kohala. That courthouse is quaint but quite outdated. We have significant concerns for safety, space, noise, temperature. The legislature provided last session $4 million for design funds. We deeply appreciate that, and we're moving forward with DAGs. And at this point, we are ready for construction funds. This courthouse serves constituents from Waikoloa over on the west side, if you will, northwest side of the island, over to the old Ocala Dairy. So on the I guess northeast side of the island. This facility, and I appreciate members of the committee that visited over a few weeks ago or a couple of months ago. It would appear to me like a converted district park pavilion. It's really challenging for the individuals and the staff with significant safety concerns with wooden jalousies, no cell block, and so the individuals, the defendants who are brought in custody remain in a van outside, where public defenders speak to their client through the van window, among their other custody defendants who are there that day. So that's our significant CIP request. The next two are to replace AC equipment on Kauai and Hilo that are near the end of life. At this point, they are near the end of the useful life, not beyond it, which is good, and they are admittedly still working, but we are already experiencing extremely long lead times in other facilities. We've ordered AC equipment for a facility on Oahu, and it's been already over a year and we haven't received it. So we'd like to get ahead of it for these facilities and request this funding at this time. Next is the Kahumanu Hale elevators, which is a project at our circuit court building on Punchbowl Street on Oahu. We appreciate the legislature's significant funding to date. This request is hopefully to finish the job. We have learned from DAGs that the project will require this amount of money to get it done. We have been working on this and seeking folks' consideration and working with the legislature, and again, fortunately receiving funding for going on nearly 13 years now. And so we would just really appreciate continued consideration to get it done. And the last would be lump sum bond funds to address various issues for our facilities across the state. With that, I'm happy to answer any questions, and I appreciate the opportunity.
Great, thank you. Members, questions for the judiciary? Rep. Russo? Go ahead.
So you're requesting, I think, 3.2 million for the security, private security for the courts, and we actually heard also from DLE that there was it was a challenge for them because of their vacancies to adequately support you folks. So I understand that request, and we are actually hearing from multiple departments and agencies about a need for more security, and it seems to me, and so I guess I'm asking if this is a temporary bridge, or if you folks are thinking that this is the path you'd like to go down. And, I mean, I see it as kind of normalizing, privatizing safety and security, and I'm not sure. I think there might be a lot of questions around training. There might be a lot of questions around like the authority. I'm not sure how much success we've seen in other jurisdictions of using private security in our court systems. So maybe if you could expand on the proposal a little bit more.
Thank you very much, Representative. We very much hope that it's temporary. We've appreciated our work with the department and its predecessor over the years, and we appreciate working with Director Lambert now. But we very much hope that it's temporary and that their staffing can get back up to speed and they can get back in our buildings. So that's first. In terms of the training and authority, these folks would not have law enforcement authority, and we are working very thoroughly to make sure that if and when we do bring them private armed folks into our building, that we will have a significant amount of training requirements, not only for the individuals, but protocols in place for how they work with and defer to deputy sheriffs and our court administrators and other things, just so we make sure that there are no communication lines crossed or things like that. We are working now with a national consultant that has significant experience nationally and internationally on these kinds of matters to make sure that if and when we are able to put them in place, that we've got all our protocols straight, and we'll be able to put out an RFP, again, fortunately, summertime, that would have all of these details lined up so the company would be straight as to where they go and how they're doing their work. In terms of other jurisdictions, we've seen a variety, and I think in other jurisdictions there's a really broad variety because there's a mix in terms of funding sources. But I think the primary issue that other jurisdictions have faced on this issue is whether the private folks have law enforcement authority, and that's something that we're going to address head on. I'll just circle back as I close. Again, we hope that it's temporary, not long term. We are very mindful and are not at all intending to replace public servants who do this work. We've been, sharing with HGEA and again with Director Lambert that we want to be fully transparent, and as soon as they're able to be back in our buildings, we'll be happy to have them.
Thank you,
Thank you, Vice Chair.
Actually, a follow-up to the security question, I guess how short are you across the facilities? What is this, how many facilities or bodies are we looking to cover with this 3.25?
3.25, thank you, Representative. 3.25 would cover about 18 or so individuals. That would be enough, we believe, to be a significant increase from where we are today. It would not take us up to an optimal ideal level. We settled on this amount and 18 individuals as we're contemplating again the requests and realizing the context of the state's fiscal circumstances. But we believe 18 would allow us to be able to flexibly move folks around. So we anticipate having individuals assigned a certain number for each of the circuits, if you will, or each of the counties. And then depending on the day, whether DLE has other demands that day of serving warrants or a high profile case in our building, or they have trainings, then we could flexibly move individuals around. So 18 would not bring us up to optimal levels, but it would be a significant increase. And as just one real quick example, we've got and I think I shared before individuals, the main courthouse on Maui has not had an armed deputy at the front door for a while now, and that's something that we would like to remedy.
So is the current situation more like we're just doing base services with what we have with the DLE and law enforcement officers available, and this kind of gets us closer to like the level that you'd like to see? Or okay, so no, so it's right now we're not at the point where we're cutting access or cutting court hours because of the shortage. This would just kind of keep us where we are and raise the level of security to where it would or not optimally, but closer to where.
Generally yes, this would allow us to, it's just still focused on the perimeter. We have other concerns, up and down inside the building as, folks are, maybe they get in a scuffle on the floor or something like that, on a floor. As families are kind of getting into it with each other, and those are of deep concern as well. But this would just really focus on the perimeter. We have had to close courthouses before with the lack of deputies, and then hopefully this would help with that. But we're not closing them, I would say, on a regular basis, so that's not primary focus for this.
And sorry, for follow-up. And as Rep. Russo mentioned, when DLA did come before the committee, they also talked about their issue with manpower and the ability to get people in. Where is the conversation though? Are they going to prioritize you? Because I know like their main focus is Judiciary and then around the Capital District, but also, in recent years where they're talking about starting up a lot of other things, right? The Ag Police, DOT's talking to them about Highway Patrol, which they said they're using existing personnel to do just with like supplemented funds. So I hope the conversation still with Director Lambert that, these shortages, knowing that we're going to be supplementing with private services, is the intent to still prioritize getting any new positions they are funneled into these spaces that they're not able to fill right now?
That's certainly our hope, that new positions are we are prioritized, but I defer to Director Lambert on his priorities. I know that he's working on increasing the size and the frequency of the recruit classes, and so we're hopeful on that end. I think in the last recruit class, we've gotten one, but we're hopeful, and I'll keep talking with Director Lambert.
Thanks.
For the South Kohala CIP request, can you remind me, because it's escaping me, what options are on the table for converting the existing facility should we approve funding for the new facility?
Thank you, Chair. The existing facility is a DAGS facility, so in some sense we would defer to them. As we vacated, it would revert to them. It's not our property. We'd certainly be very happy to have it be a DLE office. That would be wonderful for us, but I think we don't have the authority to make that kind of decision.
Gotcha. Okay. Additional questions for the judiciary?
Sorry, I had one.
Yeah.
Actually, sorry, this is a question is Dr. Harbison here? Yeah. Criminal Justice Research Institute. So this committee, talked extensively again with Department of Corrections and Rehabilitation about the jails, and DOH about the Hawaii State Hospital, just to about the decompression that's necessary from a lot of the individuals coming through our criminal justice system. So just wanted to see if we could get an update on your work that is going to, I hope, really help inform the decisions that we can make about how the entire health of our criminal justice system is working to kind of help with some of these other issues that are leading to some really big costs for the state. So just if I could just get a quick update, anything since we've talked last time.
Sure. Erin Harbinson, Director of the Criminal Justice Research Institute. Thank you, Representative, for the question. So we last year created the data warehouse that essentially brings together data from the Department of Corrections, the Judiciary, and arrest data from the Department of Attorney General. And with that data, we can report out on a lot of the metrics that are under our statute for pretrial. At this time, most of them are more tied to court decisions and pretrial, things like pretrial release, bail, things like that. Excuse me, my throat's a bit dry. We are also, and I should say that's what's in the first round of our annual report this year. With our project, it is kind of an iterative project that we're working on. So we do have some data from the jails that we have integrated into our data warehouse. But as we were working with it, there's kind of some limitations with where it's at now, and especially as they're building a new database, kind of from a cost efficiency and process efficiency standpoint, we've kind of delayed integrating some of the jail data that you might be kind of more interested in. And then in terms of, I know you also mentioned, I think the Hawaii State Hospital, correct? Yeah. Mm-hmm. So we are not bringing in any data from them. However, through some kind of court and jail information, sometimes we can answer some of those questions like that. So I guess I would say to some extent it might depend on the specific question or topic of interest in terms of where we're at in terms of would it be something we could report on next year or something more long term. It kind of depends a little bit on the specific data. I'll stop there. I don't know if that's a good starting point or if you have follow-up questions or if there's maybe something more specific I can address too.
No, it's just my hope that you can continue forward in this work to again give us that kind of real actual picture on what the system looks like and what some of our policies might do based on what's happened historically. Mm-hmm. I guess, is there any kind of update you need to maybe your mandate in the statute or anything, or access, or it's gonna be updated so that you can get access to some of this other information? Would that be helpful?
Yeah, thank you for asking that too. Since we just created the system, it was completed last summer, and so in the fall, we really prioritized targeting the metrics that we knew we could report out very efficiently. And so now we're at the phase that we're targeting some other metrics that are a little more complex in terms of how we work with the different data sources. So at this time, as we do that,
we are kind of mapping out what are some of the gaps that we have, which might be just due to data entry, what are some of the gaps that might be more technical, and what are some of the gaps due to lack of data that we didn't get through this process. And from there, we can kind of lay out some different options and kind of present those, because some may be tied to additional data sources that and agencies we haven't even brought in yet, and some might be, due to statute changes. It's pretty complex, so we kind of wanted to, in this first year, really understand some different options so we could present some kind of pros and cons to different approaches, and if they're resource driven or not, and be able to lay that out. So that's the plan for this year, to get a better handle on some of that as well.
Thank you. Thank you.
Rep. Russo?
I have a question about the request for the $574,000 for the substance abuse or substance use contracts for probationary adults, and I'm wondering, just because we are seeing that struggle really evident in our community, and it is in some part clear in folks who are exiting criminal justice system, and because they're not getting adequate treatment, then they're also cycling back into criminal justice system. So I'm wondering if it seems like such a small amount for those contracts, and I'm wondering if if we are just doing the bare minimum, and if you could speak to that.
Sure. Thank you, Representative. In terms of amount, this amount would bring us back up to the baseline that we had pre-pandemic. We're certainly mindful, and we've spoken with folks in the True Cost Coalition and understand the concerns. But at this point, in light of the state's, financial challenges, we come to you with the amount to bring us back up to the pre-pandemic amount. So that's in terms of amount. In terms of the impact on the individuals in the community, we believe that that said, we believe that this would help us secure the type and volume of services needed for our probationers. So we do believe this would be adequate. I'll just one other note in that the instability that we've had to sort of juggle recently in recent years with this decreased amount available has had an impact on probationers, has had an impact on the community, because even though when a judge orders a defendant to probation, at that point it's between our probation officer and the probationer and the provider to try to get together and get things started. And when delays happen, then in some instances the probationer has without that treatment they've reoffended or done something else, and so that delay does actually matter.
Yeah, and I'm just thinking of the costs that are visible in the other parts of the system, like when that person does go back in the prison system, it is actually very expensive. So preventative action, I think, is really important.
Absolutely.
Thank you.
Thank you, Sam.
Thank you, Chair.
Thank you. Any other questions? Seeing none, what we're gonna do is we're going to recess briefly to allow for the transition for the Department of Budget and Finance. Thank you very much for your time and all the good work you folks are doing. Feel free to keep in touch. All right, recess. Aloha, we are reconvening the House Committee on Finance. We have a budget briefing now from the Department of Budget and Finance. Welcome and proceed when you're ready.
Aloha and good afternoon, Chair, Vice Chair, members of the Finance Committee. My name is Seth Colby. I'm the Acting Director of Budget and Finance. Just to give you a brief background, one paragraph background of what the Department of Budget and Finance does is we develop the governor's budget, multi-year financial plan, and manages the state finances. BNF is a service agency, which means that we do not provide public services directly to residents. Rather, we work with other departments to translate policy into financially sound, executable budget. Our role is to ensure that state priorities are affordable, obligations are met, and the resources are deployed efficiently and transparently. I've been, I assumed this role several weeks ago, and one of the I just felt super lucky that we have an excellent management team that is dedicated and extremely talented, and I'd like permission to introduce them today. Of course. Thank you. So to my right, we have Deputy Director Nasir. We have Rod Becker, the Financial Administrator and Acting Budget Administrator. Mark Anderson, Administrator of Office of Federal Awards Management. Tracy Ban, Administrative Services Officer. Back there. And then, of course, we have the leads of our attached agencies. So we have Calbert Young, who is the Executive Director of the ERS. Donna Tanaki, who is Assistant Administrator of the ETF. And John Ikanaga, the State Public Defender. So our requests are very limited. Our budget request is officially 4.3 billion. 98% of that is associated with fixed costs. Again, we are a service agency, so those are us providing financial support to our sister agencies. 2% of our budget is related with actually direct departmental operations. In terms of specific budget requests, I'll go over the fixed costs first, which is for the fiscal year 26, we're requesting a decrease of 149 million, and in fiscal year 27, 137 for general funds for debt service financing. We're requesting a decrease of 2.98 million for general funds for health premium payments in fiscal year 27. We're requesting 1.8 million in general funds and 320,000 for special funds for the Commission on Salaries and Adjustments. And we're requesting 3.5 million in fiscal year 27 for fringe benefit costs needed for the ERS. This is non-general funded positions. We are requesting one full-time position at the ERS as a budget analyst and one full-time position at UTF as an investment officer. Lastly, we have a request associated with the Green Fee, Act 96 for $43.5 million. That is it for the budget and finance. We look forward to any questions you may have.
Nice and short, thank you. Maybe for the edification of the committee and for anyone watching, it's probably 10 people, can you walk through that proposed decrease and kind of why and what the implications are?
Sure.
The 149.
The fixed deck?
Yeah.
Okay, so if you go back, in fact, just for our members' point, if you actually look at you look in our table under Form A, and you look at on the third page, you see justification of request. This is for the title of the request is debt service funding for the state. If you go through, we have an equation that we use to calculate debt service financing that changes from year to year, and the decrease represents adjustments to that equation.
Okay. That makes sense? We're good? Okay. I got a small one too. So I think we'd already reached out about the pay raises that were funded for the public defenders, and you folks are handling it?
Yes.
Okay.
Yeah, Okay, so first of all, as a
But this is clearly all your fault.
Yeah.
You've
But
had
like
time,
we're
you
taking
know,
this seriously. Like
yeah.
I just want to share my experience. I spent most of my time as a professional civil service here, and being paid on time is like really important to people who spend their time in, you know, especially for our public defenders who are doing God's work and are being paid less than what they normally would be able to do. We take this absolutely seriously, just to make sure that we're all on the same page. BNF came in with this request last year, right? It was granted on July 1st. It took some time for it to, it was always gonna take some time for us to process those payments. It took longer than what we wanted, and that was because we were low staffed. So our HR staff went from 4 down to 1. We're rebuilding that. Just as a reminder, the minute you hire somebody, it doesn't solve all of our problems. It actually kind of slows things down because you actually have to train these people. So this is always a high priority, and we've been working on this. We've actually even enrolled the DHERD into this. So by January, at the end of January, everything will be processed. It will take some payroll, like a couple cycles to work through everything, but essentially we feel good and we feel that this issue is going to be resolved. We're working lockstep with the public defender's office and to educate them, and we understand that, you know, throughout the government, you know, human resources is an issue, and this is just a reminder that when you get your HR staff decreases, it really endangers, it like puts at risk all of your operational ability. So, you know, one of the first things, our priority is we are still looking for a HRO, human resources officer, and that's the number one priority for our department, so we can get fully staffed up.
Okay, thank you. Members, questions?
You asked me questions.
Huh? Oh, you're good. Okay. Anyone else questions for BNF? Do you have a question I should ask? Nothing?
We
You
were
good?
hoping to beat the Office of the Governor's
Yeah.
budget briefing
Oh,
time,
that was-
but I think
He caught me off guard.
we're still in the running.
Okay, I'm okay. Does anyone wanna just come up and talk? You guys are good? Alright. Okay, we're gonna recess briefly, and then we're gonna reconvene with the Department of Land and Natural Resources. Recess. Aloha, we are convening the House Committee on Finance. We have the last of our 3 budget briefings for our 1 p.m. agenda. We're joined today by the Department of Land and Natural Resources. Please proceed.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Ryan Kanako. I'm the first deputy for DLNR. I'm acting on behalf of Chair Don Chang. Mahalo for the opportunity to present. Behind me, I have our administrators from Land Division, Lauren Yasaka, from OCCL, Michael Kane, from Bureau of Conveyances, Mike Imanaka, Engineering Division, Dina Lau and Gason Ching, from the Division of Aquatic Resources, Brian Nielsen, from the Division of Forestry and Wildlife, David Smith, from the Commission on Water Resource Management, Kira Kahahane, from the Division of Conservation and Resources Enforcement, Jason Radula, from the Division of Boating and Ocean Recreation, Megan Stotts, and Tanta Shima, from State Historic Preservation Division, Jessica Puff, from State Parks, Alan Carpenter, and we also have our Administrative Services Officer, Cynthia Gomez, our IT Officer, Lila Los, Human Resources, Al Shutti, and our Communications Director, Andrew Lawrence. I'd also like to recognize our administratively attached agencies. So we have our CCMAC Climate Commission, which is the Climate Commission, Kaho'olawe Island Reserve Commission, that's Mike Naho'opi'i, Ahamoku, that's Limana Damate, and as well as our Mauna Kea Stewardship Oversight Authority representatives, led by Executive Director John DeVries. So our presentation is broken up by program ID. It's gonna be highlighting accomplishments, and then we're gonna move on to what we're working on, as well as operating and CIP requests per program ID, if that makes sense, and we can move on that, okay. So for fiscal year 27 supplemental budget request, our operating funds request is 19.4 million. It's $1.7 million request in general funds. The remainder of that is 7.7 in special fund ceiling increases, as well as $10 million in federal fund ceiling increases or conversions from federally funded unbudgeted to budgeted positions. For our CIP, we're also seeking an additional 34.8 million in GO bond funding for CIP. We're also seeking authorization to use 1.5 million in federal funds towards CIP, for a total of 35.3 million. On recruitment and retention, in fiscal year 25, we conducted 179 recruitments and filled 162 positions. We are improving timelines for the recruitment by not just using DHERD's process, but also our own internal delegated recruitment process. And then outside of that alternative process, we also are working with DHERD on using the Operation Hire Hawaii, which is their new program that came out last year. I do want to note that the 25% vacancy rate, that includes positions that have yet to be established or are unfunded, so we can't actually fill them. If you were to take that out, it's actually at 16% vacancy rate, which is good. We were at the pre-COVID levels. So moving on to the programs themselves. So LNR 101, that's our land division. We're not going to be requesting any operating budget. There's no operating budget request for this fiscal year or additional CIP. So as far as accomplishments go, in 2025, the division completed the demo for the vacant Uncle Billy's Hotel in Hilo, as well as secured 9 lease extensions that were conditioned on the closing of cesspools located on the leased lands. Finally, on the Act 90 transfers to the Department of Agriculture and Biosecurity, we got Board of Land and Natural Resources approval for transfer of 5 leases totaling 13,000 acres. And that comes out to, in this administration, we've transferred over about 50,000 acres total under Act 90. CIP that Land Division is working on, so statewide, there's the cesspool closure push. We have $1.5 million already in CIP. There's a breakwater removal that's on Oahu for the Shangri-La property. It's elimination of the Diamond Head breakwater as seen in the photo up there. And then we have a project on Kauai. That's the Lower Kapahi Reservoir removal. That's to remove an unsafe reservoir to mitigate safety risk to downstream communities, as well as a planning effort for East Kapolei transit-oriented development out in East Kapolei for our DLNR parcels. Also under LNR 101 is our Office of Conservation and Coastal Lands. They regulate the conservation district lands statewide. That's our watersheds, mountaintops, shorelines. OCCL also does not have a budget request this year. OCCL has been focusing on coastal restoration and resilience. For 2026, there's a few coastal and beach restoration projects planned, totaling about $500,000. $150,000 is going towards restoration work on Kaho'olawe, that's in partnership with Kirk. $150,000 on Kauai, that's in partnership with state parks, and $200,000 for statewide project development, with Maui being the furthest along. That's in partnership with UHC grant. Also in LNR 101 is CCMAC, that's the Climate Commission. And so their role is to coordinate climate policy across state and county agencies. Accomplishments for this past year was development of climate action pathways. That's a roadmap for a community-driven roadmap for climate resilience statewide. Also adoption of a working definition for climate equity, as well as securing funding for a solar energy program manager that is housed within the Hawaii State Energy Office. No supplemental requests for CCMAC. LNR 111, that's our Bureau of Conveyances. Also no supplemental budget requests for the Bureau. Bureau is our repository for real estate transactions, so all deeds, leases, other land conveyances, they all get recorded here, so it's a high volume operation. Essentially self-funding due to the fees and transaction fees. BOC is continuing the efforts to modernize. So it's a lot of investment in digitization, increases in online services, as well as fraud prevention tools like our Property Watch that we've been rolling out and promoting last year. So as far as accomplishments go, in addition to the Property Watch, I would say continued rollout on the digitization. That would include digitizing documents all the way back to the 70s, as well as reducing on the land court side the backlog for certifications. So that's been reduced by 3 years. LNR 141 and LNR 810 are two program IDs under our engineering division. So engineering division, they support all the other divisions within DLNR on CIP implementation, with exception to DOBAR, who has their own engineering capacity. So in 2025, engineering helped implement $32 million in CIP and repair and maintenance projects. That would be to park facilities, public safety projects, like on the picture shown is our rockfall mitigation work that was done at Diamond Head. Additionally, engineering hosted the 16th annual Floodplain Manager Conference on Oahu. This is the first time we've done that since COVID. And then finally, there was engineering completed a FEMA-sponsored technical assistance grant to improve dam emergency preparedness on Kauai. Kauai was the only county awarded that CTA grant. But in addition to that, there was emergency action plan workshops held on Oahu, Maui, and Hawaii Island. And under the engineering division, there's the dam safety and flood control. So they completed 89 statewide dam safety inspections. So there's about 123 regulated dams and reservoirs. They went over their goal of having, inspecting half of the total 123 this past year. So there are a few requests for LNR 141 and 810, or no requests for 141 operating side, but for, let's see, for 810 there are two operating budget requests. One is an increase in expenditure to re-describe an office assistant 3 to a procurement specialist, That would be to support the flood control and dam safety section, as well as a ceiling increase to cover BNF special fund assessment, as well as a small buffer to cover some operating expenses. 810 also has a $2 million CIP request for our rockfall and flood mitigation program. That's to focus on work at Kalalau to do rockfall mitigation, slope stabilization, and on Hawaii Island for flood mitigation work in the Hilo area. LNR 401 is our Division of Aquatic Resources. DAR manages aquatic resources through its 4 pillars: community planning, faunal practices, monitoring, and restoration work. Top accomplishments for 2025 is advancing sustainable ocean management through establishment of co-management partnerships that would be in the Kipahulu community-based fishing area as well as the Maunalua Bay fishing management area. In addition to that, it would be continued protection of marine ecosystems. When a boat hits reef, they assess damage, the divers go out there to save and repair damaged coral. That's on a case-by-case event basis, and as well as enforcement of against illegal fishing practices. So I know it wasn't in 2025, but this past board DLNR meeting, we did assess a $10,000 administrative fine against an illegal longline fisherman that was engaging in illegal longlining in state waters off of the coast of Kona side. Additionally, DAR has generated about $3.9 million in 2025 through its programs, such as the ocean stewardship fee, that are assessed on a per person basis for users for commercial ocean activities. These funds are then reinvested towards restoring and protecting aquatic resources. So LNR 401 has a few operating requests. First one is a reduction in $139,500 in regular federal funds and adding $116,000 in other federal funds to better match the actual mix of grants that are expected. Another going down the line. So there's a $11,367 special fund increase, and this is tied to a salary upgrade for a staff for an existing office assistant position being reallocated to a higher level, office assistant 3 to office assistant 4 due to increased responsibilities. As well as establishing a 1 FTE and a special fund increase for another position. It's a restoration of the program specialist 5 position that was previously eliminated. This position is to oversee the non-resident recreational fishing license that was launched last year, as well as oversee the ocean stewardship user fee and manage commercial fishing licenses. Finally, there's a CIP request for DAR in the amount of $550,000. That's to convert a cesspool system located at the DAR's Nui Fisheries Research Center on Sand Island. It's to connect to the municipal sewer. Funds cover design and construction. Up next is multiple LNRs, 102, 172, 402, 407, and 804, all falling under a Division of Forestry and Wildlife. So Division of Forestry and Wildlife programs, they collectively manage over 1 million acres of state lands. They support our watershed protection, wildlife, wildfire response, endangered species recovery, and public hunting. Many accomplishments across the LNR programs, including filling a lot of vacancies with only a 58.5 vacancies remaining in the 274 division-wide positions, planting hundreds of thousands of native plants across the state, investing in watershed protection via our fencing programs, and getting our volunteers out there to help out. So leveraging volunteer resources for the mission of the programs. LNR 402, so we're going to just deep dive into the DOFA programs. LNR 402, that's our native resources and probably most well known is the fire protection program. that, so in FY26, there were 22 new fire positions, and we're currently establishing positions, and as we establish them, going out for recruitment. These are positions that are deployed statewide. In addition to that, so there was a community fuels program that was established last year, and through that program, there were 9 grant awardees from Oahu, Hawaii Island, Maui, and Kauai. LNR 402 has 3 operating budget requests. First is adding 3 full-time equivalent positions and $135,749 in federal funds to support 6 positions. So, and there was confusion about this at the WAM hearing too. LNR 402 is a funding source for half of the position, and then LNR, I believe it's 804, is the funding source for the other half of the position, so for a total of 6 positions. So 2 separate program IDs are both federally funded, but they're feeding towards these 6 positions. So the 6 positions are Forester 5, or not Forester 5, sorry. So yeah, 2 wildlife biologist 4s, 1 natural resources management specialist 3, 3 forestry, and wildlife technician 4s. And the other budget request is a change of means of financing for 0.5 FTE from other federal funds to a general funds, and this is for the Forester 5 position. So it's reduction of 71,500 in other federal funds and a transfer over of $45,000 in general funds from other current expenses to personal services to cover that position. Currently, the Forester 5 position is paid through a federal grant, but those duties extend beyond the grant scope, and that's where the transfer of funds from current expenses and personal services comes in. Finally, there's a request for increase in federal fund ceiling of $850,923 in federal funds and $5.5 million in other federal funds. That's an adjustment per expected federal grant revenues for this coming year. We have 1 CIP request for LNR 402. That's $750,000 for Maui base yard office roof repairs and replacement on Maui. Funding is going to be used to replace a leaky roof at our Maui DOFA office. LNR 407, that's our natural area reserves and watershed program. There are 2 operating requests for this. It's one is a federal fund ceiling increase of $430,000 to reflect anticipated grant awards for this coming year. In addition to that, it's a request for 15 FTEs. These are supported by federal funds. It's the FTEs are already hired for their people in the positions, but we're converting 15 unbudgeted federally funded positions into the formal budget. And these positions are paid for through the Department of Defense Readiness and Environmental Protection Integration Program, the DoD REPI program. For LNR 102, that's our Legacy Lands program. FY26, no requests from LNR 102, but I do want to highlight that this past year there was 5 land acquisitions through the program. Approximately 2,700 acres were acquired and put into conservation. LNR 172, we have no requests this year. That's our forest resource management program. We had a $5 million general funds award last year. That's going to go towards a number of things, mostly to support the forest management, watershed management. For LNR 804, that's the hiking and biking and riding and hunting, our outdoor recreation, forest recreation program. Again, there's those 3 full-time equivalent positions requests. That's $135,000 in federal funds, and it's going towards that, supporting the half FTE towards the 6 staff. Additionally, we're requesting to repurpose $47,223 dollars positions. Woo. In existing general funds, shifting from other current expenses to personal expenses to upgrade an abstractor 10 position to an assistant administrator position in DOFA. So DOFA is one of our largest divisions, and they do not have an assistant administrator. So we're trying to change that. Finally, there's an increase in a request for increase in federal fund ceiling for the Forest and Outdoor Recreation Program by $853,103. Again, that's anticipated federal grant funds. DLNR 404, Commission on Water Resource Management, CWRM. They protect our water resources. Recent work includes deep monitor well construction, updated water use plans, as well as that would be the statewide ag water use and development plan, as well as the county of Kauai's water use and development plan. We began last year developing the Keoho Aquifer System Groundwater Adaptive Management Plan. DLNR 404 has one CIP request. This is $2 million for plan design and construction of a deep monitor well. This monitor well is sited for placement in the Waianae on this island. LNR 405, it's our adult care. We have no requests, just a highlight. I'm sure most of you have seen in the news that we were recruiting in the beginning of this year for our adult care 301 positions, 53 total from vacancies mostly from vacancies or positions created in 2025 and previous 2026. So as far as like the recruitment went, it went very well. We had 800 applications. We closed down recruitment in a matter of hours for Big Island and Oahu, and then days later, the other islands followed. So total, it took about 4 days to get 800 applicants for these positions. We're expecting to do start academy this summer. Our 801 is our division of boating and ocean recreation. They manage our harbors, ramps, and ocean recreation facilities. In fiscal year 2026, accomplishments included a vessel acquisition, harbor system repairs, as well as wastewater improvements on Oahu. We have several operating budget requests for DOLBOR. A special fund increase of $5.4 million. That would go towards several things. $250,000 to purchase vehicles to replace aging vehicles. That would be statewide. $150,000 to procure a vessel that will replace an older vessel that's on the Big Island. And $5 million to go towards statewide repairs for our facilities across the state. We have a $12.5 million CIP request. That's to continue the Lahaina Small Boat Harbor reconstruction. This $12.5 million CIP will be focusing on reconstruction of the harbor's outer marginal wash, as well as other related improvements, replacing electrical systems, resurfacing paved areas, and repairing retaining walls. LNR 802, that's our State Historic Preservation Division. No supplemental requests from SHPD. Some accomplishments, we filled 12 key positions in FY 2026 and supported Lahaina recovery through sponsoring a $81,000 grant to Maui County, and we are currently developing and advancing the statewide preservation plan update. LNR 806, that's our state parks program. Some accomplishments from last year. We completed campground design guidelines to be rolled out statewide. Issued an RFP for one of our most popular camping sites in Malay Kahana. That would be a public-private partnership where I think some of you recall there was the cabins that were operating over there, so we're doing an RFP for those type of services out of Malay Kahana. And opened a new shaded picnic area and brought back food trucks to Diamond Head State Monument. There are a few requests from LNR 806 from theme parks. One operating request is a transfer of 1.646 million from our current expense budget into personal costs to hire 27 park positions. They include park caretakers, interpretive specialists, trail and access specialists, tree trimmers, truck drivers, planners, engineers, park maintenance supervisors, heavy equipment operator, a botanist, and a higher level interpretive specialist. These would be positions that would serve Hawaii Island, Maui, Kauai, and Oahu. In addition to that, there's two CIP requests that we have in. It's to add 8.5 million in GEO bond funding and $500,000 in federal funds for state park infrastructure improvements statewide, and 3.5 million for expansion of the Wailuku River State Park for planning, due diligence, and acquisition of almost 300 acres of land in Kaumana. LNR 906, that's our administration. We support all divisions, that's including the chair's office, so that's fiscal, HR, IT, communications. For our fiscal office, we're requesting 3 new accountant, 4 positions. These are these are federal funded positions totaling $318,355, also funded through the DoD REPI program. And it would be to support the management of federal grants. In addition to that, there's LNR 906 has a request for $4 million for the HPU Hawaii Loa campus acquisition and renovation. These funds would allow for post-acquisition renovation of those improvements. And then just want to highlight that we have funding for and are continuing to implement our Act 182 Explore Outdoor Hawaii website. This past year, we won 4 awards and 1 honorable mention for the website itself, for design, usability, effectiveness in communication, that kind of thing. So our Red Hill Vi team, that's a new addition to LNR 906. They were established a couple years back, and then last year there was the policy coordinator that was a position that was clarified in statute. LNR 906 is the Red Hill Water Alliance Initiative. The Red Hill, or not part of LNR 906, sorry. Red Hill Vi is multi-stakeholder, so that's members of the Ledge, DLNR, Board of Water. Red Hill Vi has 1 request, that's to establish a $2 million ceiling for the Red Hill Remediation Special Fund that was established last year. The request for ceiling will enable the expenditure of anticipated funding to address public education, research, monitoring efforts, and future costs associated with the remediation of the aquifer. So there's a little bit of a delta between the request that went in to the committees and what we know now. So in the interim, around like December as well as this current month, there's been an update on estimates for environmental monitoring and testing, as well as research for remediation, groundwater modeling. So it supports actually a higher ceiling number, about $5.5 million. And I want to take some time to turn it over to our other administratively attached agencies, starting with Ahamoku, if can. So Ahamoku.
Sorry. Aloha members of the Finance Committee. Thank you for the opportunity to say aloha and to let you know a little bit about the Ahamoku. Ahamoku was actually created by the state legislature in the year 2006
and upgraded in 2012. So in essence, Moko belongs to all of you. And our whole purpose is to bring the natural traditional histories and practices of each of the 606 ahupua'a within the Pai'aina, the state, and the 46 moku forward to work with and collaborate with Western policies. And this will ensure that the sustainability of our natural and cultural resources, which are really mandated in the DLNR mission statement, is also mandated in the Ahamoku statement. So we enjoy working with all of you. DLNR has been a wonderful partner and asset for us, bringing Native Hawaiian voices forward as they were never brought forward before. Thank you.
And no supplemental requests for all.
No requests, none.
Thank you. Next up, thanks, Imana. Next up is our Kaho'olawe Island Reserve Commission.
Hi, aloha. Mike Nahopi, Exec Director, Kaho'olawe Island Reserve Commission. The Kaho'olawe Island Reserve Commission was established to manage and provide safe and meaningful use of the Kaho'olawe Island Reserve, which is the island and the 2 miles of water surrounding the island, for traditional cultural practices, education, and cultural, and for restoration and rehabilitation. And just 11 days ago marked 50 years since the first protest landings on the island of Kaho'olawe. And us and in partnership with the Protect Kaho'olawe Ohana, is celebrating 50 years of Aloha Aina through the state through a series of different events. We opened with a historical museum exhibit at the Bailey House last week, and we will end the year with a big concert down at Bishop Museum in November. Our major accomplishments from last year were we were awarded the International Blue Parks Award at the United Nations Conference on Ocean. We are one of 34 blue parks in the whole world. There's only 2. We are the second in Hawaii. Papahānaumokuākea is the first. We are the only second one, and we were awarded it because of our ocean management, biodiversity, and cultural resource integration to our program. We are currently filling our last vacancy, so we will have 0 vacancies, but we can always use more people. So we're always seeking more help on the island. And we just completed a major federal funding for coastal restoration and continuing it on the same project through a combination of state funding from other agencies, and also Maui County is throwing in money with us to continue demonstrating what is possible on coastal restoration, that we can export it to other areas across Hawaii. And lastly, the photo you see on the right is our Kihei Education and Restoration Resiliency Center that we hope to build. We didn't make it into the budget this year, but we are continuing to ask for $4.25 for phase 2, so that we can build a site at Kihei that will be a multi-purpose education, museum, archives, and revenue generating, so that we don't have to come back here all the time and ask you guys for money. We want to make our own money, just need an investment, and hopefully you guys can support anything that may come down the pipeline later through this session. Thank you very much.
And finally, Ms. Eleanor 909, Mauna Kea Stewardship and Oversight Authority.
Aloha, John DeFries, Executive Director of the Mauna Kea Stewardship and Oversight Authority. In July 1 of 2023, when the authority was born, it triggered a 5-year clock, 60 months, of which we are now in month 31, leaving 29 months to complete our assignment. Highlights of this year include a series of 6 meetings throughout the island of Hawaii and various communities to help draft what has become the strategic framework. A pivotal component to the next step is the development of our comprehensive management plan. In August, we retained the services of a planning firm following a RFP award. led by SSFM and a collaborative referred to as Kua Uvakea. Tonight, one component of that planning effort starts with community meetings now outside the island of Hawaii as well. Tonight being in Maile, Waianae area. I will say that the 12-member authority, of which we're fortunate to have Acting Director Kanakaole as one of the 12, has been diligent in providing the kind of guidance, and in particular, there are members of a performance and oversight PIG, as much as I don't like that term, but I have to say that they're putting in like 40-hour weeks to help the staff get through the challenges that we have. We currently have 7 positions that were authorized a year ago. And all 7 of those, as we sit here today, remain open. And I'll tell you that 15 months ago, when those positions were requested, we had one very traditional view about how this transition would take place. What we discovered was that of that 7, if I were to focus on that, at least 5 of them, the most qualified candidates, currently work for the Center of Mauna Kea Stewardship. And so it didn't take long to realize that every time, if I was successful in recruiting someone from CMS, I'd be weakening them and opening a temporary position to be filled. So about 10 months ago, we started a conversation with the University of Hawaii to look at how do we acquire the entire system, okay? And so we're moving now into contract discussions, scoping it right now, coming up with a term sheet which can be run up the flagpole at the University of Hawaii and up my own flagpole with the performance PIG that looks at contracting the entire system to now come under the roof of the authority and as an incremental step toward all of those employees eventually transferring over. Once we do have that contract, we'll be able to engage the human resource expertise, the legal expertise, the appropriate union representatives to design the crossover that will best serve the interests of the staff. So we feel we can accomplish that by July 1 of 2027, a year ahead of the deadline to complete this. One of the overarching priorities is the fact that the leases, subleases on Mauna Kea expire on 2033. What's going to be incumbent on the timing of getting to new leases is that we are able to complete our management plan, part of which will determine what the capacity on Mauna Kea will be in terms of the number of observatories, and in addition to human impact that's happening nightly with tourism and rental cars and that type of thing. So we need to be able to complete that portion of the plan, which that plan is scheduled to be delivered October, November of 2026, which will then enter the boardroom, the authority room for debate. And concurrently, we are working with the observatories to understand how we can better synchronize this to meet their urgent needs to have certainty in their lives, and at the same time not compromise on the community engagement portion that is cornerstone and foundational to our efforts. So I'll stop there.
Thanks, John.
Come see us on the Mauna. Yeah.
That ends our presentation. Open for questions.
Right on. Thank you very much, first off, for coming, and our thoughts with Director Chang. Best wishes to her and her family, and to all of you who had to operate without her in recent days and weeks. Who wants to start us off? Yeah, there you go.
Just related to the dams, good work doing 89, right, in the last year, the inspections. I'm just wondering, the 89, did you say there were 183?
123.
123. And then what data do we have in terms of how many are unsatisfactory or poor condition?
I don't have,
roughly.
we file an annual report with the legislature every year. I don't have the numbers.
I'm sorry, I should know that.
We can send that report that we filed with.
But it's a good portion, right? Is it simple majority?
I can't say.
Okay. No, and I'm just wondering, right, I guess for the grant program that we have, if we can get a quick status update on that grant program, and if you were fully funded a year from now, where would we be with those numbers? It's just kind of where I'm headed with it. I can look at those numbers fine. Sure.
Did you want amount needs for like
Maybe
in
rough,
a best
but just
possible
see-
world?
Yeah,
how much
sure,
do you
best possible world, but also kind of just where the grant program is now. I know people applying isn't really quite happy with it and whatnot.
So we had 2 awards recently. How much were they for? Maui and Kauai.
Yes, Maui and Kauai. I believe one was for 750 and one was for 500, so 1.25. It wasn't the whole amount of the funds we have. I think we have 5 million.
Yeah.
So we're holding that in reserve for any additional grants awarded or to supplement the 2 awards.
DLNR Engineering Division, by the way.
Sorry.
No, thank you. And then, where's the program in terms of, I think people haven't started to apply it, right? We're just keep going through rules or private owners?
There's applications incoming.
They are coming in?
Yeah.
Okay. Do you have an idea about how many or?
I don't know.
They received 17 applications and out of the 17, they awarded 2.
Okay.
To Wailuku Reservoir 6 and Waiakurua Reservoir.
Okay, thanks.
Okay, thank you. Yeah, go ahead.
Thank you, Chair. Thanks for coming. Appreciate you guys. Was really looking forward to this presentation. 4 questions, 3 for you, Acting Chair. The land court, you had mentioned the backflow is down. You reduced it by 3 years. What kind of back?
Certification is 2, and Mike Imanaka, please correct me on this, 2021? Yeah.
Chair, members of the committee, Mike Imanaka, Registrar of Real Conveyances.
So in the slide, it said that the backlog had been reduced by 3 years. What's your backlog timing if someone was to submit it?
Correct. Right now, we reduced it by 3 years, but it's about 7 years right now.
Wow.
To
And it is-
finalize certification.
To finalize certification.
Yeah, okay, all right, thank you, I was just curious on that. And then for you, Acting Chair, the DAR staffing, I mean, that's like, you guys are kind of a shining example, well, probably have some of the best stats that we've heard so far in the state, far as recruitment and vacancy rates. What do you, is there anything different that you can attribute, cause doe care has been traditionally a tough position to fill as far as I could remember.
So for doe care, I think the floodgates opened on terms of interest when we were able to do the academy. Because that allowed folks that did not have, and Chief can correct me if I'm wrong, but folks that did not have prior law enforcement experience to.
Oh, so you're just able to hire people
who are interested and wanna do the job.
Gotcha.
But just didn't have the law enforcement experience.
Oh, yeah, well, that made a difference.
Yeah.
Fantastic, and then last one, for the Kaho'olawe Commission. Yes. Thank you, I appreciate all you do, and so we talked about this last year, but just please refresh my mind. Cost of the proposed facility you'd like to build.
So right now,
Any
the
cost
phase-
projections?
the phase two part was to do the design, construction planning and finish all the permit and work the original cost estimate for construction pre-COVID was about $30 million for the whole facility. We already have the land, we already did the conceptual drawings. We actually got a SMA permit, but that was pre-COVID, and part of this estimate that this second phase is to figure out what's the construction cost really gonna be on Maui when we're competing against Lahaina and all the other construction projects.
School building and.
Yeah.
And so, and based on that, like, have you formulated or ballparked any, you talked about being self-sufficient, is part of that paying, like a lease to own rent, or I mean, that's.
Well, we already have the property.
I mean, for the construction.
Oh.
Or is it just to pay for, this investment will pay for your ongoing operations and will just free the state from providing funding in the future?
Yeah, this investment is to build the facility, and then from the facility, we have a captured 500 people audience next door at the Kihei Small Boat Ramp that go on the Molokini tours, and when they come off the boat at about 10 o'clock, they're tired, they're hungry, and they're looking for something to do instead of going somewhere else, because they don't have any place to go nowadays. So they just walk right next door. We'll charge them a admission fee, we'll have a restaurant for food, we'll have hot coffee to feed them, we'll take pictures, we'll generate multiple revenue streams that we can generate from the facility that will then go into our trust that we can utilize for operations on the island.
And do you think that would replace state funds?
I'm hoping to replace, I would like to keep the employees and the workers on the state side, and because currently we only have about $600,000 for infrastructure, and we're also we make the water, we make the electricity, we run the boat service out between the island, and we take care of all this stuff. I'm hoping we can be self-sufficient, but this phase 2 is also part of the calculation, because that we'll get the consultants that can tell us, hey, what's the revenue generating capabilities of these areas and tax revenue. And we're also looking at maybe getting federal partners that can utilize the facility, be a small conference center for the area so they don't have to go to the hotels and spend a lot of money, and get Maui County partner into this too, because we're there and we've been working with Maui County, so trying to share the load with everybody.
Perfect, thank you, appreciate it. That's great.
Reverend Moikau?
Hi, I have some Kauai questions, 3 of them. So the first one would be, well, early in my career, I had DLNR had asked if we could do a West Kauai base yard. So we were able to get CIP funding of, I think it was over $5 million to begin that. And they did do soil sampling, and then change in administration, that priority fell off. So it never did happen. Now today on Kauai, I'm getting requests for that same area to put a base yard for DOFA, but possibly for other agencies in DLNR on Kauai, so they can faster get to the fires up in Koke, right? So it's not in here, but I'm wondering if that is something that might be on your radar.
That was not on my radar personally. Did we have that in a request and it did not come up?
We've been requesting funds for that. We would like to.
It just unfortunately did not make it into the CIP priorities.
In this year, but
Yes.
it's something that would be a priority in
Yes.
the near future? Okay, thank you for that. Second question would be the sand bypass at Kikiola Boat Harbor. That is supposed to be a program that happens every so many years because of the boat harbor and the way it blocks the movement of the sand. What is the status on that?
I believe funds were appropriated for that last year.
Yes, but I don't think the project has been done.
Yeah, we're working on release of funds, correct?
We are, that project should be starting soon.
Okay, are you gonna?
Follow up with our engineer, but it's close to being started.
Are you gonna need more funding for that, or?
It is possible reoccurring funds for
For the
project-
next time?
Yeah, for the next
But
portion
not
of
for
sand
another
bypass.
couple years or so?
Yes, thank you, Representative.
Okay, and then my third question, it's regarding the Kikiola Boat Harbor. I know there's gonna be another ramp that's gonna be put in because of the heavy use of that boat harbor. There's also an improved parking lot area. And I'd just like to know what the status of that parking lot, it's on private property, but it helps the use of that boat harbor.
Thank you. Megan Stats, I'm the Boating and Ocean Recreation Administrator. So I've heard that they were looking to do something with that parking lot to try to help with the boat harbor, but we have not received an update, but I can definitely follow up on that for you.
I'm just curious to know what the revenue generation might be, although it's not state revenues, I'd just like to know. It's obviously a big moneymaker possibly.
It could be if they have somebody running it and charging for parking. From what we've been hearing, they're looking at opening it but possibly not charging for parking. So we're still kind of getting a little bit of conflicting information, but we know that the landowner was still trying to finalize, I think, some of the ins and outs of what they were gonna do. But I can try to follow up on that for you.
Okay, thank you, I'd like to know
course.
about that one. And just the last question, the Waimea Canyon Lookout. When is that gonna be completed?
State Park.
It's been a while now and it's just overwhelming amount of tourists that are visiting the canyon. And they're all over outside of the lookout.
Yes, thank you, Rep. Alan Carpenter, Acting Administrator for State Parks. It opened January 10th.
Oh, perfect.
Just completely.
So I can imagine the revenue there is gonna be tremendous.
It is one of our high revenue producing parks for sure. And that will help with the crowding and overflow traffic. That's the first stop and the most important stop in the park, so we're glad that's done. And if I may add, we also just completed the road from the Kalaa Lookout to the Pu'uokila Lookout
That's to the end?
to the end. So
Thank
that-
goodness, we weren't
for
able to
everyone's
visit
information,
that
that was one of the worst roads in our entire park system.
That's it, we were told the
Popular.
bus would not take us past.
Right,
Okay,
all new, and it's either open or opening very soon. So people
oh,
will be able
that
to enjoy
is
all areas of the park.
good to hear. Now, just my last question would be, are we gonna do something about those cars that are just parked outside of the parking area alongside the road like we had in Hyanna?
That's a good question.
Is that our jurisdiction?
It is, so that is a combination of DOT, right, and they're also making tremendous progress on the road from the boundary with Kokee down to Waimea. At Ha'ena, we worked with DOT to create a special highway zone and created no parking zones and higher fines. We haven't gone to that
Yet.
level with DOT presently. I think it's worth trying. Of course, above the boundary between the two is state parks. And I think it's less of a problem there because there's fewer trailheads. I think it's a solution worth pursuing. I can tell you that it is addressed in the latest DMAP, right, which I'm on that committee for Kauai. So I think we'll work on the solutions moving forward.
And just, sorry, Chair, just one more thing. Community-based, what is that? You know, where the community takes an organization and,
Co-management.
yeah. Is that possible for Kokee?
Well, because there are no permanent residents, it's a little more, there's less of a permanent presence up there, right, and less people affected. But there are nonprofits, there's a number of nonprofits embedded in the Kokee Waimea Canyon area who we could potentially work with, so it's not out of the realm of possibility. And I also, should I put a plug in for, there's gonna be a bill rolling through this session to try to perfect co-management agreements that will go beyond state parks and include the whole department.
So it would open it up to the other divisions as well to do co-management agreements in their jurisdictions.
Alright, thank you.
Thank you. While you're there, does anyone else have state park specific questions? Okay, Rep. Gideon?
And you may have already answered this, but for context, could DLNR clarify the current balance of the state park special funds? How much is already encumbered and how much is available for new projects?
So available for new projects will be up to our ceiling, right, which is I think 31 million. And it's budgeted, I think we're budgeted to spend about 28, we like to roll some over. We do have more than, so the ceiling is higher than our revenue. So, but that's because we have built up a balance when we had an artificially low ceiling coming out of COVID, right? So we raised our fees, started pumping money into those accounts, right? And our intent, of course, is to reinvest it all in the system. And so I don't have the exact balance, but it's high and
I
but
have
we
the
need to
balance.
reinvest it. Thanks.
It's 37.7 million.
Okay, and you may have just answered the second part of my question, but if there's a meaningful unencumbered balance, would DLNR support limited statutory flexibility to use a portion of those funds for closely related climate change projects such as coastal erosion mitigation, wildfire prevention, or climate hardening park infrastructure without impacting the core park operations.
Chair's a follow.
Are you able to?
I understand the question. I feel that state parks have been neglected for so long that our infrastructure is so old. I mean, our state parks and I are about the same age, and neither of us are aging gracefully. And
don't be too hard on yourself. Don't worry about it.
I mean, my fate is sealed, but the parks can be reinvested, and I think there will be a time when we get to that point. But things are rough under the ground. I mean, within the last week, I found out, we're blowing transformers at Sand Island. We may have to redo the whole electrical system. There's brown water coming out of taps at a loop trail. These are big systemic problems that we need to fix. And then once we get to, we can now afford to maintain things and keep them up, but they're just, we neglected them for too long. So I would love to have the opportunity to reinvest, build the parks back up to the standard they should be, commensurate with our amazing resources, and then we can talk about it.
Thank you for that. My second question is for fishing and enforcement.
Is it okay if we circle back to that?
Yes.
Just because I do have a state parks question, I don't want to do the whole thing. I'll come right back. How do you folks determine fee structure when you're kind of starting that at a park right now?
So it's a good question. We established our fees through rulemaking, administrative rulemaking. For a few decades, it was incredibly low. It was like $1 per person or $5 per car, regardless of how many people were in the car. And with your support and sometimes your advocacy, we went back and reevaluated it, and we raised our fees during COVID. They are now embedded in our administrative rules, and so the fee structure it's dependent on the type of park. So for example, a state park or a state monument, it's a $5 entry fee plus the commensurate parking fee, and a relatively higher parking fee for commercial vehicles depending on their capacity. Parks that have a short length of stay, we call them waysides, is a much lower fee structure, and it's only parking. We don't charge for the occupants because it's like sometimes a 10 or 20-minute stay rather than a half day or all day. You guys did authorize us to be flexible in our pricing and we can now go to the Board of Land and Natural Resources to have differentiated pricing. We haven't done that yet. I would like to do it comprehensively and include things like camping and lodging once we get the standards improved and just look at it all.
The reason why I ask is we actually just started at our Rainbow Falls area in Hilo, and it caught a lot of people off guard, but also like people just go look at the waterfall and then they leave, right?
Yep.
Maybe someone on the committee has a sister that has like a bunch of kids, and it was like almost $50 just go look at the waterfall. Just putting that out there for future consideration.
You are not the
You
first
really just
person
go look at the
who
waterfall and then
brought
you
that.
leave, so
Yeah.
it's not even a hike.
I get it. I was on call with Fish about that.
But I appreciate the aggressive stance on record. Okay, any other parks questions? Any other parks questions? Okay, Rev Giddy, you have another question?
Yeah, well,
Fishing enforcement.
Yes.
Aquatic resource? I don't know, what's the question? It depends.
Sure.
On
Yeah,
the
it just has to do new regulations that were put in place and benchmarks.
Yeah.
First, I want to congratulate you guys on the recruitment campaign. Amazing. I grew up spearfishing and fishing, and I've seen firsthand how staffing shortages could let netting and undersized taking of fish go unchecked. So my question, when conservation measures are put in place, does DLNR establish clear performance benchmarks and timelines so that if fish stocks recover, as intended, regulations can be responsibly scaled back without requiring new legislation? And if those measures do not show measurable improvement by a certain date, is there a formal process to reevaluate and replace them with more effective approaches?
Yeah, great question. Brian Nielsen, Administrator for Division of Aquatic Resources. So we call that adaptive management, and it's an area that we're trying to practice more of, but it's complicated just because a lot of our fisheries data is kind of ups and downs with population, and it's hard to count things that you can't see most of the time or under the water. So the estimates of a fishing population are there's a lot of error in that. So trying to assess the population, whether it's increasing or stable or declining, it can take several years to do that, but it is an area that we would like to do more of. I can give a couple of examples, like the bottom fishery. There's a stock assessment that's conducted every 2 years. They look at the status of the population and then set the catch limits based on the status, so that could go up or down or stay the same. So that's kind of the gold standard of adaptive management. But other examples are like the bottom fish restricted areas. Those were closed areas to bottom fishing. The populations were doing really well, so we opened those up. So adaptive management doesn't have to mean more and more restrictions. It can go the other way as well, but it's something we'd like to do more of, but yeah, it can be complicated.
And how do you guys collect the data?
So we, a number of ways, so all commercial fishing that's done, commercial fishers are required to send in monthly catch reports. Any fish dealer that's selling fish, they have to send in weekly reports of what they purchased so that we can match those things up. So that's a big source of data, is just the commercial fishery. And then in terms of the fish out in the water, we have divers that go out and count fish and scientific surveys and do that over time and over large areas and try to track the populations that way as well. Okay, thanks.
Okay, Morikawa, and then Chair, question after that.
Just a quick question for can you give us a status on the Papahanaumokuakea monument? Is it open now or not?
Yeah, so the Papahanaumokuakea was a national marine monument, and then during the Biden administration, there was a process that overlaid a sanctuary designation over it. So now it's still a monument, but it's also a national marine sanctuary. The Trump administration has had some calls for comment, that type of thing, in terms of potentially opening up some fishing activities. The Western Pacific Regional Council has also had some agenda items talking about the feasibility of opening up some fishing that could be long line fishing from 50 to 200 miles from the Northwest Hawaiian Islands, or there's some proposals, everything outside of state waters, so the 3 mile line, and could possibly be bottom fishing, lobster fishing. So there's lots of proposals out there and calls for comments, but right now the status is it's closed to all fishing. Yeah.
Okay, good.
Thanks.
Thank you.
Thank you. Chair Hashem.
Okay, Ryan, as you know, we have two forms of land transfer in Hawaii. We have the regular system and the land court system. Don Chang and I were discussing elimination of the land court system. And she said she was working on that and looking into it. Do you have any update on what progress she has made? I know you're not her, but
Yeah, not. As far as this conversation has been going on for a couple of years now. We are working with legislators on a bill to establish a working group to bring all the stakeholders for land court, including not just the real estate side folks, but the landowners themselves who are the beneficiaries of the land court, the torrent system. There's certain protections that land court can provide to these large landholders, right? So we're working on legislation to establish a working group to create a process on looking at how, if it is to be phased out, how that would happen without too much disturbance of the system, the users, the beneficiaries, as well as the people within DLNR that work in land court. Anything else?
will you be coming in this session for with legislation on that?
We don't, it's not part of our package, but we expect it to come out of the commerce committees.
Just yesterday, Senate Bill 2041 came out, so we're reviewing the bill. So that has a lot of provisions that Brian is talking about, where you have a stakeholder group reflective of the entire industry. So when you hopefully develop the policy, it's reflective of all the stakeholders involved. And as you know, this question has been in existence for many years. And by having the voices within the room, we hope to come up with some good legislation and come in with a phased approach, not just a stroke of pen. So we're looking forward to working with that group and testifying on behalf.
Okay. Our last question regarding that. So the employees, the people that are working in that department will just be routed. Those resources will be moved to other departments within DLNR?
The focus is never to eliminate jobs. We want to support them, whether in the judiciary or the bureau. We're always going to support the employees and ensure that there's enough work involved there. So regardless of whether there's a phased out approach, yeah, they'll be kept, absolutely.
Thank you, Chair.
Thank you. Members, additional questions? On this side? Yeah, alright, go for it.
Welcome, happy New Year. Thanks for being here, Brian. This is in regards to our Commission on Water Resource Management, and I noticed that you guys have done the state's agricultural water use and development plan, and then there was another slide about completing sustainable yield study. I think you're kind of halfway through that. Curious on when that sustainable yield study will finish, because water use and development plan informs the general plans, which then informs development plans and our community development plans. It's kind of this cycle.
So currently we don't have a timeline for the completion of the sustainable yield study. We recently lost one of our key longtime employees who was really heading up that project. So I do apologize, I don't have that has really significantly jeopardized our timeline for updating sustainable yield. So it remains a priority for us, but it's probably not gonna be forthcoming this year, or maybe not even until.
So I'm just gonna push some urgency on that, because when it comes to the sustainable yields, which drives our development plans, which drives our housing plans, and it has been a priority for this administration to develop housing. And so if I could just, again, it has to move up on the priority list, because then if we're trying to achieve housing and we don't have water, we're stuck. Thank you.
Thank you.
Thanks, Chair.
Okay, thanks. Additional questions? I have a couple of land division questions. Hi, thank you very much for joining us today. I was wondering, and I try to avoid regional questions, I don't wanna set a bad example, but I do have some questions about the status of the Kanoilehua industrial lease extensions, and whether there are some that are actively, in that process of going through renewal, or kind of where we're at.
Lauren Nisaka, Acting Administrator for the Land Division. We actually just completed a whole bunch. We're actually almost through, I think, majority of the ones that we're expecting for this kind of portion of the year. My understanding from Candace, who is our acting Hawaii District Land Agent, is there's a couple more left coming in. Some of them, they have expressed interest in extending, but they kind of missed the window for the application and the review to get it in on time. So we're working with them for new direct leases through, I believe, 149 and 236, which is the more statewide one.
That's helpful. And then kind of on a similar topic, this is kind of a philosophical question that'll put you in a tough spot. But anyway, we just completed the Uncle Billy's demolition, and thanks for your assistance in that. My understanding is when it was originally financed in the budget, it was going to be utilizing the SLDF funds. And then, because I believe the Land Division wasn't inclined, it was then reappropriated using GO bonds. But given that the SLDF, a lot of that revenue is generated by the leases, why should the state be using GO bonds to fund the demolition of land division lease projects?
We do pay debt service.
So SLDF pays debt service on the Uncle Billy's GO bonds.
Okay.
Yeah.
We're okay on that one. Alright. So I think part of the complication, right, is like we understand the revenue generation, and it's gonna be used for, you know, projects around the state and that sort of thing. But we don't wanna end up in a situation where revenue is extracted, but revenue is not put in. And I think, you know, at least in our area, given that there's three of us here, that seems to be, you know, there's a lot of urban blight. And, you know, kind of the only resort area we have in East Hawaii is really just falling apart with very little infrastructure invested by state or county. But, you know, just food for thought. And then I think the other question we would have is kind of on that same topic of Banyan Drive. You know, I think we worked pretty closely with you folks and Chair Chang. Is there any progress on the acquisition of the golf course property?
So I'm actually working with HCDA now on the golf course itself. I think we've gone through the process of engaging with, I guess they're the financer that is holding the property now. And we're also working on legislation to basically get the legislative support for withdrawal of that portion of the lease lands.
Okay, thank you very much. Any other questions for Land Division? Go ahead.
I wasn't gonna take a deep dive into Banyan Drive, but our chair did. I was just more curious around the demolition of Uncle Billy's and recognized that we used an incredible tool, which was an emergency proclamation. Because it was so blighted, we were able to kind of get it down quicker, along with the funding mechanisms that we use. I was just wondering if the department had taken a look at a debrief, because we recognize oftentimes the delay in repair and maintenance comes from a number of red tape that we have to go through. But the emergency proclamation kind of cut through that. And I've noticed a number of CIP projects, repair and maintenance projects, that I'm guessing could go faster if we took a look at that bureaucratic red tape and as a state agency provided pathways for exceptions and exemptions so you guys could get to the repair and maintenance, encumber the CIP funds and move through that process faster.
I think the hope is not to get to the point where we have to get an EP, and so it's better planning. With that being said, you know, Uncle Billy's was I guess I don't wanna say one-off, but you know, it was in the position where it was a public safety issue and we had to request the EP for it. As far as debriefing on expediency in terms of like getting the CIPs through, cutting the red tape for 103D, I mean, short of an emergency situation, we are bound by 103D processes, the procurement code. You know, there are limited exceptions, emergency procurement, that kind of thing, but I mean, we would leave it to the legislature to give us more tools, because I think I can speak on behalf of the divisions, you know, getting the contracts up and running is an issue.
But I can say that as practice now, at least for the land division, for when we issue these new leases, we are including a provision that requires a lot of our lessees to have a removal bond now, so that there's money set aside for when instances like Uncle Billy's does occur.
Yeah, I think there was some valuable lessons. I think we have an adjacent property with Country Club kind of experiencing the same look of Uncle Billy's, and
Yes.
I'm just trying to learn those lessons. I do appreciate the demolition bond, but I also feel strongly that within the terms of the lease agreement, there needs to be more check-in and maybe even a step-up process for that lease arrangement. Because if we're leasing out assets and facilities for 30, 40, or 55 years, things change over time, and I'm trying to help, really. I really am trying to help. I just learned incredible lessons with Uncle Billy's.
I think we're in the process, right, of trying to look at those lease conditions and seeing how they can get adjusted so that we don't find ourselves in another Uncle Billy situation. And I do know right now, I think the the removal bond is one of those things. Requiring the phase 1 ESA is environmental site assessment is one of those things. And I do know that in terms of step ups, like the removal bonds for some of them, especially the longer term ones, we do require that the removal bond amount be relooked at a certain point in the lease so that that removal bond is escalated to the current pricing at that time.
Yeah, absolutely, right? You can have one now and 55 years later, it's not gonna cover.
Yeah,
So I really
correct.
do appreciate you guys using that lease tool to kind of adjust with the times.
We've added a couple additional legislative or tool authorizations, including like the ability to get third party or put it upon the lessee to fund our inspections so that the rate at which we inspect the properties can be more tightly and a tighter cadence.
Yeah, and to our chair's point, it's Banyan Drive, it's KIAA. It all happened from the 60s because of the tsunami. I mean, we're all at end of life for a lot of these facilities and assets. It's healing, so thank you, Chair.
Rep Kush, you had something?
Yeah, I'll just catch you in the hallway.
Okay.
I'm sure there's a little more to Hawaii than Banyan.
No, thanks. I already felt bad. So. Okay, Rep Russo, you had something? No, you're good? Okay, additional questions for the department? We're good? Alright, okay, seeing none. So we will be reconvening tomorrow at 9 AM with the Department of Commerce and Consumer Affairs, Department of Business, Economic Development and Tourism, and the Department of Transportation, 9 AM, January 16th. Thank you very much for all of your hard work and for your time today. We are adjourned.